horrible.
It's okay.
Canceled that, but it did it anyway. Does this make you want to sing a song? Maybe. This background noise. I always want to sing a song. It's a form of torture. Yeah. But chronic repetitive noises like that and like.
That drives me nuts.
OMG. Gosh dang it. Be quiet. Oh, is that itchy?
I'm Dr. Joya, and skin is my specialty.
Oh, your skin's peeling off.
When a mystery pops up, that case comes to me.
Let's start looking at you.
Things are looking better.
This job can be sticky, gooey, and stinky.
Ew.
But I love every moment of it.
I love this. Amazing turnaround.
I know. Pops, he's our little hunting dog. With him being 13, he's going very strong. I know. I know. We're here because Pops developed a tumor on the front of his chest, and then it started to just kind of drop and started dangling.
If you guys would like to follow me this way, I'll get you settled in a room.
Whenever we go out to the woods, it's smacking him in the front, kind of holding him back whenever he goes through any kind of brush or the briars or anything. And normally he kind of has to cock his arm a little bit, just kind of swing it around, but he just walks right on along with it. Him's our old man. He's the best dog we've ever had, though. We're a little worried about it being cancerous. My grandmother, she had a dog that had a small mass. As soon as they found it, they removed it, and within a month later, we lost her. So, well, there's a lot of anxiety. We don't want to lose Pops.
How are you, little friend?
This is Pops?
Yes.
What a cute name. How long's that been there?
Well, it started out up against his chest. Last year, it's actually, like, fallen.
Pops has a very dangly mass. It looks like an acrocordon. They're often in areas of friction, so the chin, armpits. These are benign masses, but they can get bigger and can extend. You end up with this mass that's just hanging there like, I can't say what I want to say it looks like. It's like silly putty, you know, just.
He's ready to part ways.
Possibly. So we're a little iffy about even having it removed, just because if it is cancerous, we don't want it to ignite it and spread it.
Looking at it, it probably is a benign tumor.
Okay.
It's nicely encapsulated, and it's just got this hangy skin right there. We can remove it just fine.
Okay.
His tumor also has a little friend with it. You see that?
Yep, it sure does.
It's got a little tick on it.
Your tumor has a tick. Gross.
He took off on me this morning, so.
Yeah, he's got at least 3 or 4 on him. We'll get those off for you.
Pops spends a lot of time outside, and he is covered in ticks. Like, everywhere you look is a tick. Ticks are bad. They can carry lots of diseases for animals and for humans, so you gotta get them off.
All right, start finding some ticks. There's a tick on his scrotum. Jeff, do you want to pull this tick off this scrotum?
Sure.
Be my guest. Let's play a game. How many ticks do we think is on this dog?
I don't want to play. It would give me the heebie-jeebies. Who in the world thinks it's fun to pull ticks? Dr. Joya, that's you.
I'm gonna go with 11. Jeff, you lost the tick?
No, I got it.
There's one.
There's one in his armpit.
This is the worst.
I'm pulling tick after tick off this dog.
2 more on this paw.
And we're just adding them to our tick jar.
There's one on the anus.
Poor Pops.
Yep, that's still moving. How many was it, though? Was I close to right?
9, 10, 11, 12, I think 13.
I said 11.
I've not seen this many ticks on a dog before. Yeah, it's gross.
Pops, we gotta get this off of you, dude. This is a whopper.
It's a pretty gnarly tumor. I love cutting masses like this.
Go big or go home.
Little buddy.
How's it going?
It's got a little bit of like a chunkiness in there.
Ew.
Is that a vessel?
It's got a little blood supply, that's for sure.
Pops' tumor is rather large, so it is bleeding more than we thought, but that's not uncommon for a tumor that's around the head or the neck. There's a lot of blood vessels in those areas. We're just gonna apply a little pressure and the bleeding should stop.
Mom's gonna have to take time after pulling it back.
Gonna cut into this Skin is tough. It's just a firm tumor with fat.
I cut into Pop's mass, and it just looks like fat inside of it. This is a benign tumor and nothing to worry about, so we don't need to send that one out. He should feel much more comfortable and be able to return to the woods.
Come on, friend. Got a little pep in your step. I like it. Mom, I did so good. I came back with some outfit here for you.
He was licking at the incision site, so he put this little cone on him. He's gonna hate this cone. I'm sorry.
Yeah, he's like, I'm never getting back in the truck.
He should be fine. I cut into the mass. It's benign.
I was really worried, but he seems to be fine. He's still same old Pops. Are you gonna run out now? Huh? Are you gonna run? He seems to be happier now that it's not smacking him in the front. He was able to kind of keep his stride a little bit better. Oh, good boy. He'll be up to be Pops again. Oh, careful. You can't smell and walk with that on. Pops, you can't smell and walk, silly. There you go. Keep your head up. Come here, baby. Come here.
This is Buttercup. She was born 4 weeks ago Monday. She is a full-blooded Siberian Husky. We're here to see Dr. Joya today. Something's not right. Her eyes are starting to swell shut. She's got a sore on her nose. She's got sores in her ears, as well as this one on her belly. And her paws, they look like they have gunk in them. She's losing hair up here on her head, under her chin quite a bit, right there. And then, of course, right there. But her face looks pitiful. You've been so good. I cry every day. I have called over 24 vets, and everyone's pretty much done. You ready to do this thing? Huh? I don't care how long it takes to treat her. I don't care how much it costs. I just want Dr. Joya to help her.
Buttercup, that's the cutest little name. Tell me what's going on with her.
On Friday, she had a sore on her belly.
Okay.
And we took her to the vet. So we put her on antibiotics, and by Tuesday, she was getting worse.
Okay.
They didn't believe it was mange mites.
Mm-hmm. Go look at her. And obviously, she probably feels pretty terrible. See you, little girl. Oh, you have blue eyes. Can't see that eye because it's crusted.
At 4 weeks old, Buttercup is very young. She's a puppy that's still nursing. She hasn't been weaned yet. So this is a pretty bad thing to see in a dog this young.
I wondered if it was an allergy.
It'd be a super severe reaction for sure. Just doesn't have the lymph nodes enlarged that I typically see. See you, little girl. Looks like she has some little ulcers on her foot pads. I'll start looking at slides. All
No problem.
right, just be a few minutes, okay?
Thank you.
Sweet girl. Here's the little puppy. Usually I don't see that.
Oh, look at you, fluff ball.
I'm hoping these slides will give me some good information and let me know whether this is mites or not. If it's not mites, then it's likely that she has something much worse than that, and we have to do further investigation.
Oh my goodness.
You want to examine this little squirt?
Look how
See
small.
what you think? While I go stain these real quick.
Oh God. A little eyeball. You can open this one. Can you see me? Oh. I'll make you better. Oh, look at that. Get the itches. Oh, it's so itchy.
In dermatology, we don't get a lot of really young puppies. It's pretty clear just looking at the puppy that it's not doing very well. Helping animals like this who are this severe is really one of the reasons that I became a vet.
This is rare.
Yeah.
I'm looking at slide from her belly. Mm-hmm. And we've got, wait for it. Nothing really specific, unfortunately. Just a little inflammation.
The slides are not showing me anything, really. I'm worried something very serious is going on with Buttercup.
Are you done with these slides, Joya?
Yeah.
If I saw infection, that'd be something fairly easy to treat, but I'm not seeing infection, so it's suggestive of something more serious and probably autoimmune, which means that the body is attacking itself.
She can't even open her eye. It's so crusty. Aww.
Autoimmune diseases in old dogs are difficult to treat at best. So seeing this in a dog so young, we know we've got to work quickly to save her life.
You ready? The biopsy would make sure that this is a form of autoimmune disease.
All right, puppy. How tolerant are you gonna be?
Normally, we would sedate our patients to get a biopsy, but we're not sedating Buttercup today because she's so small and so young.
You ready? Be brave, be brave.
A lidocaine block will numb the area, so she should not feel anything when we take these samples.
I'm not even doing it anymore. Give me these little puppy peas.
It's okay, Mama. Try to get that little pustule there. Now she's just mad because you're holding her. Oh, yay! You did it. All right, she can come up. Here you go. She's got a lot to say to us.
She's only gonna get more vocal.
That's true. Huskies are one of the most vocal breeds.
Worst day ever.
You ready? You're all finished. You go see your mama. Here she is. She did very good.
I heard you getting
A lot of squealing. We did the lidocaine block, which she tolerated pretty well. So I don't think she felt the pain from that. It's more so the pain from being still. And
She just makes my heart hurt all the time.
It makes my heart hurt, too. She didn't have a ton of bacteria on her skin, which fits more with an autoimmune process.
I'm hoping the biopsy is going to give me a definitive answer as to what's going on with Buttercup. Likely an autoimmune disease that's attacking her system. And until we get the results, I'm going to hit her pretty hard with a high dose of steroids.
I think she feels pitiful. Well, I'm sorry, sister. You're going to need a little medication. I'm going to adjust her dose of the prednisone, check it, and make sure it's proper. We'll go from there if we have to change things up. She just needs a lot of TLC.
It can be very serious to start a dog on such high doses of steroids, especially one this young. There can be lots of side effects, but we have to do it in order to save Buttercup's life.
She does need some help.
Yeah, she's a pretty special little girl. Thank you so much.
You're welcome.
What is she doing, pretty girl? Are you grumping? It's not great news, but I feel really hopeful about everything that we have heard today. I love her so much. All I really want for Buttercup is for her to be healthy. I just want her to be the best dog that she can be. What? You're so pretty.
This is Johnny B. Good, and his sibling is in the crate because they're so bonded. Hi, little buddy. I want to point out his tail.
Yes, ma'am. Okay.
Because I just noticed that this morning because he keeps it tucked up under like a little...
A little ratty tail there.
I rescued Johnny with 5 dogs yesterday because the owner could no longer take care of them.
Hi, what doing?
He has a sweet soul. I will make him feel loved like I've had him for years. He deserves it. I've rescued a Maltese before, and they are very sweet, very intelligent, very loving dogs. To pick this baby up, he only weighs 3 pounds. I can feel his ribs, every bone in his spine, and he just curled up, and I held him here most of the night. Told him that it was going to be okay, that he was loved and safe. And I think he believed it because he slept, and he ate. Come on, can you walk? Come on. He does try to walk, but doesn't do real well with that. He tried to stand, and he shook all over because I think he's in a lot of pain. It's gonna be okay. His entire stomach area has a black coating of some sort on it. I've never seen anything like it. So he's here to see Dr. Joya.
There it is. Johnny be good. Poor little thing. Your tongue's gonna get
The
dry.
whole underside is pretty much affected.
It's okay.
How sad.
It is sad.
Isn't he sweet?
Cases like Johnny really tug at my heart. This dog was just rescued, and he's scared, and a big part of treating him is making him feel comfortable and know that everything's gonna be okay.
0 teeth. That's why his tongue is hanging out.
0.
He don't have much hair.
Okay, buddy. You're okay.
So he's got a lot of alopecia. He's got lichenification. And then these black spots are lentiginous. Sometimes those appear because of chronic inflammation.
Lentigines are pigmented spots on the skin. They're kind of like liver spots in people. They're very common in dogs as they get older and often found on the belly, the inside of the legs, and it's nothing to worry about.
You might have something internal going on, which is attributing to kind of the rat tail appearance. Do we know if any blood work's been done? Nothing.
There's no history.
Okay, so we need to do a bunch of things. He could even have hypothyroidism, but it's so hard to know because we don't have any backstory on him. I do want to make sure that there's nothing going on internally. We're checking him for infection on his skin. I'm seeing cocci and rods, so he does have infection on his skin. So we will get him on an antibiotic for that.
Johnny B. Good is a train wreck. He has been in very poor condition for a very long time, and he needs a lot of TLC today.
Oh, your nails are so overgrown. We're gonna have to fix that.
I suspect that Johnny can't walk because his claws are overgrown, and I can give him a little spa treatment.
It's a good boy.
This is a medically necessary nail trim.
You like it? You feel better? You're gonna get some new shoes. A medicated bath will help soothe his skin. You're gonna get a little scrub, dub, 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 and start him in the right direction for resolving his skin infection. His little tongue.
All right.
And he's seen a rough life. Feels good on your pawpaws, huh?
And get your little beard. That's a good boy.
Yeah, he's looking a lot better already. We're gonna get you feeling better. We gave him a full-on little grooming because I knew he needed it. He got a bath.
Oh my goodness.
Yeah.
This is his other.
Are they related? I know they came from the same
They
scenario,
came from
but do
the
you know if they're
same
litter mates or?
home, and they are bonded.
Okay. This little guy, I want to get him on an antibiotic because he does have infections. And then the blood work will help us make sure that there's not something internal going on. He has hyperpigmentation on his skin, sort of like liver spots in humans, right? As you get aged, freckles and spots on your skin.
I understand that.
And
I can relate.
but his is probably related to chronic inflammation, so I bet you a lot of this pigment will lighten up.
I'm so happy to hear that there is hope.
See if he might walk a little. You want to walk?
He's walking.
Oh, there you go.
Yay!
See, I just needed some new shoes. We go into veterinary medicine wanting to help animals, and watching him walk across the room, something that seems so simple, really meant a lot. It does really warm your heart.
You want to get out and see him?
Oh, he ran to his brother. Cute. But he's got a little pep in his step now.
We're gonna submit some blood work in the thyroid panel,
And we'll hopefully have those results back in a few weeks.
All the kisses come through. Look at him. Oh. Are you happy, boy, now? Yes, you are.
Cooper. Cooper's a family dog of ours. This is Jill's puppy.
Hi, Cooper.
He's a good boy. Hi, Coop.
Cooper's here today for us to remove woolly worms from his ears. What is a woolly worm? A woolly worm is a giant, tremendous mat of hair that blocks the ear canal.
Aw.
So he's here today for us to pluck those out.
Perfect. We'll just lay him down and, okay.
Cooper has a lot of love. He is very spunky. Big energy, but with a big heart. And I love him to pieces. His ear just gets really itchy and rubs on the furniture. So Dr. Joya is going to help me pluck out his ear hair.
Wow.
Yeah, they overgrow really bad.
Wozers. It is a woolly worm in your ear.
Amazing.
You ready?
Good boy, Spoopy. That's a good boy. Seeing Cooper sedated on the table like that's my baby, it does hit a little deeper to home when it's your own.
It's like treating my grand dog or something. Wow.
That's a
You can knit a sweater.
I'm okay on that.
That is nuts.
This is a pretty big ear woolly worm.
Ear plucking is not really something that's recommended at home. It can cause a lot of inflammation and trauma to the skin, so it's best to just trim the hair. But this hair can really grow from deep down within the ear canal, so when it gets out of hand, it's time to bring them in so we can take care of it.
That's disgusting.
This one's grosser.
Yeah. It's okay, Koopy. I know.
I like pulling them though, it's really fun.
Woolly worms happen in any breed that's super fuzzy. Shih Tzus sometimes, and definitely in the Doodle. It's very satisfying to pull these out. Like, I really love to do it, actually. It's kind of one of my things.
Joy for Joya.
Yeah. Joy for me.
That should be your hashtag for things.
Joy for Joya.
Yeah.
I love it.
Glad I could bring you joy today.
While she's doing that, you want me to do his anal glands?
If you want to.
Want's a strong word. Yeah, you know me. I'll just get some gloves.
Do I want to do an anal sac expression? No. Would I make an exception for Jill and Cooper? Yes.
From the rooter to the tutor.
My least favorite thing.
Front to the back. He's getting his full-on tune-up.
Oh, that was so much fluid.
I am very excited that Dr. Tinsley is on the back end of this dog
There's so much.
because it looks really nasty.
That's so nasty.
It was full.
Yeah, I ran out of Kleenex.
Here you
This
go.
is so gross.
I'm so sorry.
I didn't know it was gonna be so full.
I hate this. It's getting all over my wrists, and it's just kind of becoming a mess.
It's okay. It's just my job. I love it. It's so great.
Wait a minute. It almost looks like there could be a little blood in there. The color of it. They might be infected. We'll find out.
It's not the easiest to determine if you have an anal gland infection just by looking at what's in there, but whenever it's gritty, that's unusual.
He does have some infection.
Oh, no, no, no.
It's normal to have a few bacteria, but he has some that are intracellular, and there's some neutrophils in there. Anything around the butt is going to have bacteria, but this is... Jill, it's good you brought him in. It's good you brought him in.
It looks like Cooper's anal glands are infected, so I'm gonna get him on an antibiotic and hopefully get his infection under control very quickly because we need our work family babies to be in tip-top shape so that Jill is happy and we're happy.
Would you like me to wake him up?
Yeah.
This is not the spa he was looking for.
Vet techs dogs always have some kind of issue. Pretty typical.
Pick the right owner.
Stop. We can
Ah!
Sweet puppy.
I love my work family. We really support each other, and I'm gonna do anything that I can to help my work family's babies just as I would my own.
Oh, Cooper. Do you still love me? Oh. Might be a little bit of that going on tonight.
That's okay. I'm very blessed to have a wonderful team that not only has my back, but has Cooper's back.
Cooper.
They definitely helped him out a lot today.
Oh, it's your baby.
He's my sweet boy.
You know where you're going, don't you? Oh, I'm so excited. Polly's a very good companion. She's very attached to me, follows me everywhere I go. She's happy just to lie in her bed next to me while I'm working, as long as she can be with me. Come on, Polly. Let's go this way, honey. She's a food hound. She gets into everything. She opened a jar of peanut butter one night and ate a whole loaf of bread with it. Made herself a sandwich. Here goes my girl. The only thing Polly might want more than food is love. Lots of hugs and rubs. She's very, very sweet. What do you think, Polly? She was turned in as a stray. Her age is unknown. Only weighed 60 pounds. She was starved, you know. I think Polly would be much happier if she weren't itching all the time. Polly's had this skin issue since I took her out of the shelter. She is missing a lot of hair, and the skin is very black and leathery. Just chews on herself continuously and itches. She drops skin flakes like sand. She's got one of those beds that's raised up from the floor, and underneath it is like a sandbox. She sheds so many skin cells and so much hair. It's quite a mess all the time. We're going to the bridge. She loves to walk. And I worry that people will think that I don't take care of her or that she's got some horrible disease and they can't touch her. Where are you going? It's sad. We have been to the vet countless times. Just can't get this issue resolved. We haven't been able to get to the source of the problem yet. And that's what I'm hoping Dr. Joya can do.
Poor thing. She's obviously very itchy. Does she chew herself until she bleeds, or what happens?
She doesn't bleed. It's just very pink and irritated. She continues to get new growths on her skin.
She seems like she still is infected, which concerns me because when you have internal disease going on, that will slow down your body's ability to fight off skin infections.
If you don't deal with the underlying cause of the skin problem, then infections can set in, which can be itchy, and then they start scratching at the lesions, and then that sets in more infection. It just becomes this vicious cycle. So I've got to get to the bottom of this and figure out what's going on.
We'll take her back and do some testing and then see what we see on the surface of the skin, do some scrapes.
Okay.
At this point, I'm not sure of the cause of Polly's skin problems. It could be a lot of things.
Here she is, Polly.
But I'm going to start with the simple things and check for mites first.
Good mine. Way down. Good puppy.
I'm doing a deep skin scrape for
Mites. She's gotta get this so we can find out. See what's going on. You're okay, Mama.
If this is mites, this is easily treatable, but I don't really know because I don't have much of a history for Polly.
I'm looking for mites. I don't see any there. And she does have inflammation.
Seeing all the inflammation and the bacteria on the slide makes me worry that there's more going on internally for Polly. We're gonna sedate her.
Quick poke. Girl.
We need to culture, draw the blood, biopsy the skin, and take off a couple masses.
I'm gonna biopsy Polly's skin today to try to get a clear picture of everything that's going on with her and make sure that I'm not missing anything.
This is a 8mm punch biopsy. Her skin is so thick.
I kind of feel like my elbows feel the same way.
Mine too after the winter. Okay, now for the neck. This mass was bothering her. It's not healing. I think it's a sebaceous tumor.
They're usually benign, but occasionally you can have one that's cancerous.
All these neck folds. That's gonna be the tough one. Nasty thing. Pretty gross.
Sebaceous gland tumors are tumors that come from the oil glands in the skin, so it's good to take them off and then send them out so we know it's cancer-free.
Here it comes. It's coming. Oh, there it is. Then we just gotta wake this cysta up.
Polly's skin disease is still a mystery. I'm waiting for my test results, but in the short term, I'm gonna put her on an antibiotic to treat the infection and also some anti-inflammatories to keep her under control until we get those test results back.
There's my girl. Oh, Miss Polly. I'm just anxious to see about any underlying issues that she has. That's my girl. Is this really just a symptom of something else? Wait, sweetie, over here this way, Polly. Oh, it's okay, honey.
I think I have one of your crystals here in the car, actually.
Good. Surrounded by positive energy.
It can't hurt.
No, it can't. All I can do is help.
Placebo effect.
That's why I'm saying, like my ashwagandha, even if it's just a placebo effect, it's helping. Regardless of if you truly believe it's helping, it's helping.
You know, placebo effect only works in like 24%, like statistically, like 24% of.
Well, I believe my ashwagandha is like actually working. Well, even if it's not, I believe that it's working, so it's okay.
When you had missed a day,
She said she was off center. And then we said, how long have you been taking it? And you were like, 2 days. No, it was like a week and a half. Y'all, I left my apartment without taking it this morning, and I walked myself back up from my car. I was like, today is not the day to be off balance. Yes,
And so
I need you to be
back
on point in Evansville.
to take my ashwagandha. I had to be on 10.
Yeah.
We're here at our satellite office today to recheck our patient, Buttercup. When she was here a few weeks ago, I was hoping that she had a simple skin infection.
Get that little pustule there. Oh, yay! You did it.
The biopsy results are in, and it's not good news. She has a very serious autoimmune disease called pemphigus.
Hi, you Snickles.
Pemphigus foliaceus is an autoimmune disease where the body actually attacks the connections between the skin cells.
Sweet baby, I'm sorry.
It causes pustules to form and then crusts. These can lead to secondary infections, which can be quite serious. This disease is very rare in adult dogs and even more uncommon in a dog this young.
She's got heavy crust there. Yeah, we're gonna have to change her meds up considerably, I think. Oh, you're okay.
Suddenly, her face kind of got puffy, the sores spread. I'm scared she's getting worse. She's not eating and acting playful like she had been.
There you go.
It's okay.
All right, let me see your little face.
You weren't even touching it.
Buttercup.
This makes my heart hurt.
Yeah, I mean, I don't know. It's really crazy because it started about 4 weeks of age.
Pemphigus is difficult to treat in an adult dog, and even more so in a dog as young as Buttercup. I usually will prescribe steroids, which I've started on Buttercup, but it is not working. I would normally increase the steroids to shut down the immune response, but this is a concern for Buttercup.
Pustules that were on her belly have ruptured. Now it just looks like moist erosions. The crusting on her face is now alopecia. The crust in her ears are also worse. Let's get a new weight on her, too. She said she was around 3.5 pounds.
3.5 pounds? He's so small.
At 5 weeks of age, a husky puppy should be about 6 pounds, gaining 1 pound a week.
3.3. 3.3.
And Buttercup is not even half that, and she's losing weight. And it's making changing her dose of medications very difficult. She's already at the max dose.
So this is actually 15 mg per 3 ml.
Okay.
But let me check it really quick.
It's a lot of steroids for a little girl like you, because you're only 3.3 pounds.
And we're kind of at this scary point where we need to get this disease in remission, but the drugs might have some bad effects for her.
I'm so sorry.
If this was an adult dog, I don't know, maybe 50% chance. For her, it may be less than that.
Oh, my goodness.
Yeah, she's on a large amount of steroids still, so we gotta do something different.
Buttercup is the youngest and smallest dog that I've ever diagnosed with pemphigus. There's not a lot of information about treating dogs this young, so I'm going off of my experience and treating her based off of what I've done for dogs older than her.
And because she's so small, I have to calculate the doses over and over again.
I'm trying a medication that's typically used in cats because she is so tiny, and use it in combination with the steroid to get her under control.
But we might be okay. We might be okay if she gains weight, if we can get the dose right. So I'm figuring that out. All right. The steroid that she's on, I mean, she's on a tremendous dose. With pemphigus, it's generally a lifelong condition. Sometimes you can do it with steroids alone, but she's not really responding to the steroids, and other than us pushing the dose much higher, I think we have to do something different.
It's not really what we wanted to hear. We were hoping for a lot better news, and that's really hard.
You are so dedicated to this puppy.
I'm trying to do everything I can to benefit her.
You're doing
without too
amazing.
much.
It's gonna be a little tightrope walk, but we have to do it.
All right, I appreciate it. Thank you.
Talk to you soon, though.
All right,
Okay.
thanks. As long as we can get her gaining weight, I think she's strong enough to withstand everything.
All right, got your sweet baby.
Thank you. I love her to death. If she doesn't make it, it's gonna be a really hard road. I feel like it's my duty to give her a fighting chance. I'm also not prepared to let her go yet. You've been so good.
Come on back. Johnny Be Good is back today for a recheck, and he has his brother Sonny with him, who's his moral support dog. We diagnosed him with hypothyroidism.
He does have infection on his skin.
Hypothyroidism is where you have an attack on the thyroid gland and the body does not produce enough thyroid hormone.
Oh, he looks so sad.
It's an endocrine disorder, but it is a fairly good one to have because it's very treatable, and usually these dogs will live a long and happy life.
You gonna get a little scrub, dub, 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 dub.
Johnny Be Good has been on a thyroid medication for several weeks now, and I'm excited to see how he's been doing.
A big reveal. You won't believe how big he's gotten. Show him how big he's gotten.
Oh, wow.
Look how pretty his fur is. Good boy. Look at his little tail.
coat. Feels better.
I think he looks much better.
Seeing Johnny today, he has improvement with his skin condition, as well as some of the hair is already starting to grow back a little bit. It's only been a few weeks, but he's already doing so much better.
We'll check his weight, too, for you. You probably haven't checked his weight, right?
No, I haven't. I'm
Yeah,
kind of
we'll
excited
see.
about that. He feels bigger now.
I mean, he looks a lot better.
He's a whole different dog. He barks. He can bark very loud. He's a delight.
He's good.
Johnny Be Good is going to need to stay on supplement for the rest of his life, but this is okay. He's going to end up having a happy and healthy life.
Sonny, come on.
Here you go. Sonny's like, wait a minute.
They're wondering about you taking one and leaving the others.
I mean, I can take him back.
No,
I can take them both back. It's a gaggle full of
Mama's gonna
puppies.
be.
We'll be right back.
Okay, thank you.
Here they are. Actually, I need to weigh him. Let me go weigh him real quick. You stuck in my pocket? There you go. Okay, 4 pounds, 15.5 ounces.
Johnny Be Good has gained 2 pounds since his last visit, which is tremendous. That's a big deal. Like, I can gain 2 pounds in like 12 hours, but that is amazing for a dog this small.
This is how I was when I had my twins. I just rocked my babies.
Whether it has 2 legs or 4 legs, all the animals are Joya's little babies. I have to admit that it's kind of cute.
Brothers.
Yes, you want to play, Johnny? Do you want to play? They are going to be with me forever. I've adopted them. They are now my babies. They are so bonded to me, and I'm bonded to them. They're part of my life and always will be.
Hi, guys.
Oh, they just want to be cuddled.
I have a friend that stops by occasionally, and they don't go up to her.
Oh, really?
They do like you.
Oh, good.
Yeah, for them to crawl up on your lap, I am very shocked.
It's exciting to be able to piece together this mystery of what was going on with him and figure out that something going on internally was actually causing his external problems, and fixing that has been amazing in changing his whole quality of life.
They sure are happy up there.
I could sit here with them all day, but I guess I have work to do.
All right, let's go in. I brought Polly. She has severe skin issues. There has been progress at home, and she seems more energetic, a little more spring in her step for an old dog.
Come on, Polly.
We're expecting to get results today of her biopsies.
Come on, Polly.
I am hoping that we're not facing anything life-threatening.
Can I get your sutures out?
She doesn't look as flaky.
Yeah, you're right. Polly was in a few weeks ago, and her skin was terrible. She had lesions everywhere and lots of infection.
Nasty thing.
I started her on an antibiotic and an anti-inflammatory while we were waiting for the results, and I'm glad to see today that she already has some improvement.
There you go.
That looks pretty good. It healed really well. Polly's biopsy site looks great. It's healed well, and there's no signs of infection. But Polly's test results are back. We still have a lot of work to do before we can turn her fully around.
So here I am. Let's go over these results. So she has a resistant staph, likened to MRSAs in humans, but this is a canine infection, not a MRSA. She has a methicillin-resistant canine staph.
Methicillin-resistant staph infections can be very challenging to treat. Polly has the most severe resistant infection that a dog can have, and it means that most antibiotics are not going to be effective, so you have to step into antibiotics that sometimes have side effects.
Okay.
This methicillin-resistant canine staph could be why her skin was so bad, why she wasn't improving.
Staph infections like the one that Polly has can be very difficult to treat, and it's important to get rid of all of it so that we can get Polly better.
Her biopsy did come back. They didn't see any autoimmune disease or cancer on the skin in general.
Okay.
Now that we know that that's not a factor, I can focus in on getting rid of the staph infection.
I feel like we're making some headway. We've got a long way to go.
Oh, I know.
Long way to go. It takes a lot of work.
Polly's case is important to me because it's going to take months and months to get this under control, but I'm dedicated to getting her back to where she needs to be so that she can feel better.
Don't lose faith yet.
We won't. We're making progress,
I
aren't we?
think we
Yes,
are.
we are. We're very much encouraged. She's a great dog. I want her to be comfortable. I hope she's happier. I think she is. That's the main thing we want, that she feels better. Get to go home.
Do you remember this place?
Buttercup. Buttercup.
Buttercup's coming in today. I'm anxious to see how she's been doing. She was the youngest and smallest dog I've ever treated with pemphigus, and she was doing very poorly at last visit.
Sweet baby, I'm sorry. She did lose weight. 3.3. Okay.
She was maxed out on the amount of steroid that I could give her,
We gotta do something different.
so I added a second medication on so that we could better treat her. I was actually worried if she was gonna make it or not.
I'm so sorry.
Hi.
Oh my gosh, look at this.
It's a whole new dog. Who are you?
Aww. Wow, look at you. Who are you, Buttercup? What was she, 3 pounds when you first brought her in?
She is gaining a pound a week.
So much better. It's amazing. You outgrew your dose. We're gonna have to fix that. I'm gonna hold her up like this and I'll look underneath there and get a couple samples from here. I know, I have to check these.
You're okay. You got it so rough.
Oh no. Okay.
I have to look at these slides, but I'm gonna bring Buttercup back.
You want to see everybody? Say, look at this Buttercup.
She's doing really good.
The team is going to go bananas when they see what she looks like.
Let's go wow these girls. They're gonna be like, what?
Look who it is. It's Buttercup. You don't look like the same puppy at all. Look at you, cutie.
Amazing turnaround, man.
That is amazing.
Look at that belly.
Oh my gosh, she looks like a different dog.
Yeah,
she looks so good.
Holy look how good you look. Who's a pemphigus puppy under control? Who's a pemphigus puppy under control?
You are.
Jeff is super excited to see Buttercup. It's like seeing my children when I got them their new puppy.
Can I hold it?
Yeah.
I'm gonna take it.
You gotta assume her medical care for the rest of her life, though.
Puppies are super cute and everybody wants to play with them, but it ends up being mom who does all the work.
I don't see any of the cells that are typical with pemphigus, so I think the pemphigus is mostly under control.
It's such a win for all of us to see the work that we do make such a huge difference in an animal's life. Buttercup was literally on death's door, and now she's turning into an active, happy, healthy puppy again.
All in all, she's doing better. That's the best part.
We still have more to do for Buttercup. She's doing very, very well, but pemphigus is a lifelong disease, so she's going to require medications for life. So we have to find the right dose that's going to keep her under control, but we're clearly on the right track.
All right, she's back. Everybody cooed and oohed and awed over.
Did you get some love?
Yes, she did. I don't see any of the typical cells we see with pemphigus, and where she had the worst of the disease is cleared up. I'm going to create a little plan to step down her steroids and just watch her weight. I'm really glad that she's doing well. This is amazing. You've done a great job with her. She had the right mama to stick with her, that's for sure.
She put me through the ringer. It feels good. Everything's looking up. She has been a joy. She has made me cry a lot, but I love her to pieces, and I'm really excited to see what the future brings with her. Time to go home.
Remember that day I beat you at the race?
I don't remember that.
Yes, you do. August of 2019, we had a dog park event, and part of the dog park event was a 5K. So we show up. This dude's in like biker shorts and cutoff shirt, flip-flops, I don't know.
Running shoes.
I said,
Flip-flops.
do you run? And he said, only when I have to. I smoked him. I mean, like, left him in the dust. And he was just like, whew, she's fast.
I run 2 cake away from fire.
To cake and away from fire, I get it.
I wasn't in shape.
Oh, is that itchy?
I'm Dr. Joya, and skin is my specialty.
Oh, your skin's peeling off.
When a mystery pops up, that case comes to me.
Let's start looking at you.
things are looking better. This job can be sticky, gooey, and stinky. Ew. But I love every moment of it.
I love this. Amazing turnaround.
Jeff, come on, buddy.
Hi, Jeff. We're gonna come on back.
I have Jeff with me today. He has a cyst on his head, and my hope is we can just get it removed, and that will help him find a forever home.
Hi, how are you? I'm Dr. Joya. Nice to meet you. Hi, Jeff. My brother's name was Jeff, and my resident's name is Jeff. I know a lot of great Jeffs. So you guys rescued him, and
He is bonded with his brothers.
Oh, it was two of them. Mm-hmm. What's his brother's name?
His brother's name is Mutt.
Mutt and Jeff.
Ah, that's so funny. I love it.
Yeah. They've earned the nickname at the rescue as the Frat Boys because they're just goofy and fun-loving. Come here. You ready? Sit. They've got energy to play, but they'll settle down. Go get it. They're perfect dogs, in my opinion. Hi, babies. These boys are about 6 now. They have been together their whole lives, so at this point, they're going to be together their whole lives. When people go to adopt a dog, the first thing that they see is the picture. With that cyst on there, they might think that he is sick or with something wrong with him. He's had it for a little while. We've just been kind of watching it. Good boy. It doesn't seem to bother him. It's more of a nuisance, I guess, in terms of appearance. Bonded pairs are sometimes difficult to find homes for, so hopefully we can get this taken care of, and then that will help him and his brother find a forever home together.
Hi, guys. Can I take a look at you, friend, and see what this mess is?
Does it fill up and deflate, or does it stay about the same size?
It's pretty much stayed about the same size.
It does feel a little bit fluidy. Look at you. What a good dog.
It's fairly hard for a dog to be adopted with any medical problems, especially ones that look like little unicorn horns growing off. Speaking of that, I have a unicorn horn myself.
Well, we can take care of it for you if you'd like to do it today.
Sure.
Take it off so it doesn't bother him.
Well, I think Jeff wants that.
Oh, Jeff.
We want to make sure that he is as healthy as can be.
Thank you. Come on, Jeffy.
I'm gonna let you meet the other Jeff.
Jeff's mass is probably benign, but need to take it off to know for sure.
Here he is. Look, Jeff, it's Jeff.
Hi, Jeff.
He's got a brother if you'd like him and his brother.
He needs a home?
Yeah. So we're just gonna take this little unicorn horn off so there's no reason to keep him from being adopted by a forever family.
That's all? No dog named Jeff should ever be without a home. We Jeffs have to stick together.
Are you a person trapped inside a dog?
Would this be the type of dog you would be if you were a dog?
That's not how I pictured myself.
How do you picture yourself? Chihuahua in a purse, or?
No, I'd be a medium-sized dog. You'd be a Chihuahua in a purse.
Heck no, I wouldn't. I would be more like a Lhasa Apso or a Shih Tzu.
Something that
I would
bites.
be a Biva Yorkie, and I would jump this high off the ground, and I'd have a little bow.
You'd be a Yorkie for sure.
Yeah, I'd be like,
You got a lot of energy.
What breed do you think I would be, Jackie?
What breed?
Yeah. Come here, Jeff.
I have to think about that.
Dr. Jeff would definitely be something small, fits in your pocket, likes to stay clean. He's kind of describing a cat, actually.
I was thinking like a foo-foo dog.
Little.
Something that requires grooming.
high maintenance.
High maintenance.
How dare. I always thought I'd be the type of dog that's cute, but might need a little bit more attention. I mean, I always thought I would be a Frenchie.
Slicing. I'm gonna try not to pop this before it comes out.
I swear to God, if this pops on me, I'm gonna lose it.
Can you blot a little for me?
Don't cut the resident.
All right, I'm about to pull it out.
Oh my God, just cut it.
Ooh, it's like an eyeball.
The mask comes off nicely. It's not invading into anything beneath the tissue, so that's excellent news.
No big deal. Both Jeffs are doing well. One better than the other.
One's having a harder day than the other.
We're almost done. Like literally one more. Ta-da! Suture, yes. Jeff, you're all right, sweetie. Now you don't have a little horn on your head.
I think I can make him look good as new. He may have a tiny scar, but a little hair will comb over it and it'll look nice. A fur comb over, if I may.
What do you guys think is inside of this thing?
Wait, how does it feel?
You guys want to feel it?
I don't have glove on. I'm not gonna put my...
I just love to know what's underneath.
Ready? You want to watch too, Jeff?
Not really.
Now it's time to gross the resident.
I think it's gonna deflate in the black. Oh, that was worse than I thought. Did it get on
Gross.
me?
I think it went straight up.
Look at the floor.
Oh, it got me all the way over there.
The projection of it, you could hear it, the pressure, and then it just shot straight up.
Gross brown fluid.
It smells bad too. It almost looks like poop. Why do you have poop in your head? Ugh.
Great.
But sometimes there's hair in it.
It's some sort of like hair follicle oil gland cyst. Any tumor is kind of overgrowth of something that at one point was probably normal. This one is like follicle, follicle, follicle. So it's producing hair inside of the mass.
This is so gross.
I know, it's amazing.
That's great. Put it in the tube.
It's like when you pull that hair mat out of the drain. Yeah.
Come on, Jeff, I want you to squeeze the rest
I
out.
never cut mine.
You don't?
No, why?
You don't want to see what's in there and you miss the hair?
Hell no.
You miss the fun. You get to the party, but you have no fun.
That's not a party I want to go to.
I wasn't expecting it.
Yeah.
This way, buddy.
Here he is. He did really, really well. We got it off. I was able to get the whole cystic wall, which is great. So it probably will not recur. If you'd like to put like a cold pack on there when you get home, that's completely fine to do.
Okay.
And the sutures can be removed in 2 weeks.
The tumor looks benign, no cancer. Jeff is gonna be just fine as long as he leaves the sutures alone. Big Jeff is gonna be sicked out for the rest of the week.
He'll be picture perfect.
All right, thank you.
You're welcome.
Wanna go this way? Come on. Jeff did really, really well. It's not anything we need to worry about, so he can just recover from this, and then Jeff and his brother Mutt can be on their way to their forever home. Jeff, come on, buddy.
What a good Lizzie.
Their eyes move independently, so they're like, are you talking to me or are you talking to her? I can't tell.
Oh, I'm so excited, yes.
Nobody wants to be bitten.
I mean, it's not an ideal situation, but at least I'm relatively close to a hospital.
I'm super excited about the patient I'm going to see today.
Ready? My mom said I should write out my will first before I went. Just in case.
Hi, Dr. Keith.
Good morning.
How are you doing today? A colleague of mine who works with the Kentucky Reptile Zoo called me to come over and take a look at a patient of his who has a few growths that have developed on the skin.
We're gonna hopefully help this little guy out.
Yeah, see what's going on.
Yeah.
Okay. It's Puppy, right?
Yes, Puppy is his name. We brought Puppy for Dr. Joya to look at today because he has developed 3 small lumps on his body.
Do they bother him?
They don't seem to. We think they started showing up a few months ago and then just recently noticed that they started getting a little bit bigger, which of course was cause for concern. We want to make sure that it's not something that is going to cause him a long-term problem.
And he's otherwise healthy, eating well.
So, yeah, he eats very well.
Well, we'll get him out, take a look, and trust you guys on that.
Okay.
Beginning part, and Dr. Keith on the anesthesia and all that, so. Okay?
All right.
We'll have anti-venom in place, right?
We stock 10 to 20 vials typically of each anti-venom.
Yeah.
When they tell you that there's anti-venom on hand just in case, that does spark a little bit of concern.
I'd prefer to move.
He's coming out.
His head is on this end.
It's huge.
It's an amazing animal. Don't get me wrong, I love puppies, but this is not your typical puppy. Wow, it's like as big as a person.
Puppy is a 14-foot-long king cobra. And king cobras are the longest venomous snake in the world. They get the name king cobra because they actually, in the wild, mostly consume other snakes. He's usually a very good boy, so that's why we named him that. He's pretty easy to work with.
Until he wants food.
Right, yes,
When food's around, he comes flying out of the cage.
How old is he again?
He's, what, 25?
25.
Is what we think.
Puppies are a very important part of the zoo. Venom from puppies is being used as a research project to come up with a pain medication that would replace opiates. And it's also being used in cancer research. We have to go through and do health checks, so we're always looking at the animals. And if we see something different, then we contact Dr. Keith.
Puppy's been with us a long time, and we're definitely attached to him.
We want him to live as long as he can.
It's very unusual for a dermatologist to see snakes. This is my first king cobra ever. There's a little bit of thrill in that, and also to just put my knowledge and exotics training to use for him. In order to do this safely, the plan is to get Puppy into this plastic tube so that he can't bite us and we can keep everyone safe.
Puppy is an animal that can kill someone, so we wanted him to just crawl into the tube, and we hope that he wants to go there because it looks like a place to hide and get away from us.
Oh my God, it's so big.
There he comes.
He's in there.
Oh yeah, I have to back him up.
Great job, Jim. With Puppy's head secure in the tube, we've got his business end under control, but he's still wriggling like a little puppy, so we have to hold him tight until we can get him fully sedated.
We are inducing him with gas anesthesia just by a mask till he relaxes, and then we'll put a tube into the trachea or the windpipe.
Oh no. I'm on the poop end of things.
Are you holding the quig?
She told me to.
Yeah, that's a good idea.
That's a good idea.
It takes several of us to hold on to the body.
Yeah, they're
so
extremely strong animals.
Yeah.
Puppy can grab hold of a glass funnel, and if he wants to, he can break it by just clamping down.
Is that one of the nodules?
Yeah,
I saw a couple back here.
they feel
There's one right here.
almost fatty.
Yeah.
Because snakes have very unique types of lesions compared to other species, it's good to have another opinion, particularly a dermatologist in this case. It can put more education and background into assessing what we're dealing with so that we can make the right decisions.
It looks like there's just soft tissue.
I don't think it's invasive down quite to the muscle layer, which is good for this snake.
Yeah,
so
where they are.
we will prepare for surgery. Dr. Griffin's gonna work on these things and we're gonna help her with anesthesia.
I'm excited, let's do it.
Okay, let's clean it up.
Tumors are not common in snakes, so once he's sedated, I can get in and get a better look at what these are.
All right, little puppy.
The name is so cute, I can't take it. Let's see. It's like kind of like playing a game of go between the scales. Like, okay, which way will my path go? You know what I mean? So there's the tumor. It's kind of like starting to pop out. See how bumpy it is?
Yeah, I do.
Here it is. As I look at the mass, it looks like a bunch of tiny little grapes. I have seen cancer that looks like this. Puppy is older and he has several of these, so I am concerned that this could be cancer.
That one really does look like a bunch of grapes.
One down. I'm gonna send that out, and we've got 2 more to go. This one is a little more deep.
Do you think it's growing out from down below, or is it invading in?
It's probably invasive.
Yeah.
Well, I'm feeling very relieved that we're doing this now.
All of Puppy's masses have turned out to look the same, so I think that whatever's going on and causing this is the same disease. All right, so I'm gonna close the skin. Snake skin heals just like mammalian skin, but it can be a little bit slower because snakes have a slower metabolism, and that's actually dependent on their body temperature. So if everything goes well, it should heal fine, but it may take a little bit longer.
We're done.
Fantastic.
It's gonna take a few weeks to get the results from the biopsy, and then we'll be able to develop a plan for Puppy's treatment. It's a good puppy.
Ready?
Would you plate it?
Yes. It's great to team up with Dr. Keith and to be able to lend my experience and my expertise to help treat this amazing creature. It's gonna wake up like, what happened to me? This was an amazing experience, but I'm anxious to get back to treating puppies that I can actually cuddle.
Yay!
Great job, everyone.
Yay!
I'll be calling you guys with the results.
Okay.
Next snake I have, I'm coming to you.
I'll look forward to it.
I worked on a hummingbird once. So cute. They're mean.
They're mean?
Yeah. Their little beaks are like hypodermic needles. But the most challenging was working on a hedgehog.
They're adorable. Why was it challenging? Because it's so small?
Well, no, because it's got a little spice. You have to hold it with an oven mitt. It hurts. Hi, baby. What are you doing?
Molly May, sweetest little girl. I work primarily with the foster program,
Come this way. We'll get you in.
and Molly May came to us as a stray. A Good Samaritan brought her in, and she had a lot of complicating medical issues.
Look how happy she is.
A lot of those we have so far been able to resolve, but the skin issues that we're here with today, we have not.
I'm gonna go right down this hallway here. Go right in here.
When she first appeared to us, she had large mammary masses. They were non-cancerous. We removed one, sent her to foster for a few weeks, let that heal up, and then we brought her in for another one because it would have been a lot of skin takeaway. I had to try to close all that at once. When you look at her straight on, you don't really notice a lot. But when she turns sideways to you and you see her legs and her rear end, she has a lot of hair loss, a lot of thickening of the skin. It's very dark and a lot of wounds back there. Some which are scabbed over, but some which do actively bleed. It doesn't seem to slow her down much, but I know that having skin issues can be irritable. And the medications that we've tried thus far just have not worked. It's most definitely important and close to my heart that we get her treated and get all this cleared up.
Right here. All right, Dr. Joya, this is Molly May.
Miss Molly May. Oh, look at her. Oh, no.
I have no hair on my back end. Yikes.
Molly May walks in, and she looks like a cute little happy dog until I see the back end. She's kind of like party in the front and disaster in the back.
You sit. Oh.
Look at you with your expressive ears.
All right, Miss Molly May.
Isn't she cute?
Yeah, she is.
Hi, girl. Okay, I gotta look at your back.
You look scarred.
It does, but it's so speckled looking. It's interesting. It's bleeding. Ugh. It might just be scarring. I see a lot of dogs with hair loss, but Molly May's is very unusual. She has kind of a speckled pattern of hair loss, and her skin is very thickened and it looks scarred. It's something that I just don't see very often.
See it. Give paw. Give this paw. Nah, I don't want this one. I want this one. Give this one.
And then let's look at her back. Right here, so there is some infection. There's a lot of inflammation. And she has the appearance of a lot of scarring, so I don't know if this is just deep infection or if she has some sort of autoimmune disease. I wish I knew Molly May's history, because that would actually help me figure out what caused this. But her being a stray, I literally have nothing to work with. Hi.
Molly May.
She's so sweet. I heard a little bit of her story, but I wanted to go over it again with you. That surgery was done a few months ago, right?
She still has staples in this one.
You've been through a lot.
She's one of our special cases right now.
She is a special case. Her skin lesions are very unusual. Were you there when she came in?
Yes.
Did she have this same black speckled alopecia like that?
Yes. You know, she's still itchy.
The question is this something that she's always had, or is this the result of chronic infection, chronic inflammation? When you start like scraping at the crust, they kind of bleed. So she's got a bit of infection, so I did want to get her on an antibiotic for that. Molly May is going through a typical cycle. She has some sort of problem that's occurring and causing her to itch and scratch at herself, and then she's getting open sores that then are getting secondarily infected. So now we have to treat the infection so we can actually get to the bottom of what's causing all of this. She could have a hair follicle abnormality. There's a couple different ones. Like, they're both autoimmune diseases that can have some scarring, and these bald patches are sometimes able to be treated. Depends. I think biopsying her skin and getting a diagnosis would help us.
Thank you for seeing her.
You're welcome. Molly May's case is curious because there's something that's actually affecting the hair follicles and preventing the hair from regrowing. It looks like ichthyosis here. This looks like alopecia. This looks like mites, all the things. I just need to get a sample of all of her unusual spots so that I can make sure that I've covered all of my bases and figure out what's going on with Molly. So I'm gonna take a couple biopsies from this kind of scarred black area. I'm gonna go all alopecia, thinly haired area, and then I'm gonna take this crusted area. So 3 different lesions.
Oh my. Hey, Dr. Joya, take a look at this. These look like they're ready to come out.
Oh, God. This is pretty bad.
Her skin is overgrowing, the staples. They're really embedded. Poor thing. If they're ready to go, we should, because they're gonna start to curve in there. Yeah. We didn't plan on doing this, but Molly May's skin is overgrowing these staples, and they need to come out. Or else her vet's gonna go in later and have to pull these out and create open sores and lesions that potentially are gonna get secondarily infected. We're trying to prevent infection, not cause it.
This would be the best time to take them out, though. Maybe leave the top, because that's still open there. Her skin is growing around it.
I work in dermatology.
Not surgery.
Removing staples is not something that we typically do in our practice, but we're happy to help, and in Molly's case, this needs to be done today.
This used to be my job during my rotating internship on surgery.
You use staples a lot?
Oh, yeah.
Across the knee.
On the belly.
When the scar has overgrown this much, it's definitely much harder to get them out than it is to put them in.
This is amazing. You're doing a really good job. I mean, that skin is going to feel so much better having those staples out.
Got it.
This is what you're really good at, because you like the kind of meticulousness of things.
I do.
I don't have the patience. A lot of staples. You did a great job.
We did a great job.
It's going to be a few weeks before we get the results of the biopsy.
Come on, girl, let's go.
So in the interim, we're going to start her on an antibiotic while we wait.
Oh, I don't want you to walk down the steps. Today, fortunately, Molly May has the opportunity to leave with a foster parent, Sarah. She's gonna take her home, love her, feed her, give her a warm spot to cuddle up in bed, and hopefully we can get her to a better place of happy and healthy. All righty.
46, 47.
You like meticulous things. Remember the time that we made the birthday cookies and I was like angry after 10 minutes? I realized it was like all thick. I just took a knife at the end and I just smeared it on. I was like, it's a first birthday party. Who cares? And she's like, oh, I love this. I love this.
It's fine. It's just a kid's birthday.
Just give me this knife. I'm just going to slather it on.
Yeah, give Mama sugars. I have a little chihuahua named Dilbert. He is 11 years old. 5 years ago, I adopted Dilbert and his brother Diggy. I love them like they were my child. I would give my life for them. Mommy loves her little Dilbert. Yes, I do. Mama brings his food to the couch, brings his water to the couch, and make him comfortable while he takes a nap. That's his life. You know, he wants Mommy to do what he wants Mommy to do, and Mommy will do it. His infection started with his left eye. It went to his right eye, got on his nose, and then it went to his neck, underneath his chin, and on his mouth. He doesn't scratch at it. He moves a lot because it hurts. He's just real uncomfortable with what's happening to his skin and his ears. I hate to see him like that. And it just doesn't seem to want to go away. Every time you turn around, there's another spot. And, you know, I feel so hopeless. After seeing vet after vet, last vet said there's no more she can do for him. And that's when my heart dropped. And then she recommended Dr. Joy.
Can I take him inside with me?
You sure can.
Okay.
Look at his little ears. And I just know she's gonna heal him. I just know she will.
Oh, no, Dilbert. Oh, sweet baby. I'm sorry. He's so sad. Can I see your back end? We looked at the underside. Oh, no. Oh.
Hey, buddy.
Skin just looks so raw.
Mom's super worried about him.
I would be too.
Dilbert's just breaking my heart. He's got lesions all over his skin, crusts all over his face, lots of symptoms that really affect his quality of life. He's very painful. This poor thing.
Hey, buddy. You gonna get you feeling good?
Can I touch your ears? Yikes, your ear. It's got rock ears. I'm sure that hurts. This is amazingly crusty. I have not seen anything quite this bad. I know. Because I can't get the meds down in there unless we get
some of that out.
It's tremendous.
As if Dilbert's face and his body weren't enough, his ears are completely blocked and they're very painful and hard as rocks.
I don't even see the opening to his ear. Really? Maybe that's it? I'm sorry.
Oh, that hurt.
I'm so sorry.
You need some help, buddy.
A lot of stuff in there. It'll probably feel better, though, if we get some of this out.
I'm sure.
Shake your head. Shake it. Shake it.
Ooh, no. You know, he looked at me.
Oh, yuck.
I'm so
You can't. Don't do that again.
I wanted to help him a little bit.
Dilbert has the saddest little cry, and I know that he's very painful.
Oh, no. I'm sorry. Gotta get that out.
I can't help you.
But I have to get all of these crusts out of his ear so that we can actually get the medication down in the ear and treat the infection that he has.
Oh, that's stinky.
Is it stinky?
Very stinky.
Man, you don't know what this shield can do for you.
Oh,
You might
really?
want to wear one. I can't smell it. Jill, you need to see this.
Jill, come smell.
I will pass on that glorious opportunity.
It's really big. I have to catch it on the slide. Jill.
Oh, God.
And look how good you're being
He's
for
such a
this.
good baby. It's gonna help open your ear up a little bit. That'll feel better. I have a little bit of space that I can put some medicine down in.
Do you smell it now?
I smell it now.
Stinky sweet cheese.
It's sweet. It has like a sickly sweet smell.
Because you know why I say that? Because the
sweet.
two don't ever go together. Dr. Joya never smells anything. I think that's her superpower. Actually, if Dr. Joya can smell it, it's pretty bad.
His skin is pretty much a cesspool of infection.
Oh, boy. He's pretty bad.
It would be like having someone plug your ear like this. The amount of crusting that's in his ear. You probably can hear, but it's just extremely muffled because of all the debris that's in there. I think the ears are caused by whatever autoimmune disease he has, the erythema multiforme likely.
I have to biopsy it to get a definitive diagnosis.
Ready? Well,
But my gut is telling me that Dilbert has an autoimmune disease called erythema multiforme.
Poor buddy.
Here we go.
Erythema multiforme is extremely rare. It can be triggered by infection or even a drug reaction, or it can just happen spontaneously, and it's very challenging to treat.
we're getting some good crusts, so I'm hopeful that we'll get an answer.
Okay. Look how good you're being.
anything in a month.
Eardrops and oral antibiotics are going to work to treat the infection in his ears, and I'm starting him on steroids to tackle his skin inflammation. I have to treat his infection first, and then I can deal with the source of his problem.
Poor baby is very miserable. I'm so sorry for him. He does have a tremendous amount of crusting in his ears. I think the cause of it is the autoimmune disease. His body is just creating these lesions, and then the infection that's there, I think, is secondary to the skin being open.
Okay.
If it is erythema multiforme, it's a fairly uncommon autoimmune disease, but it can be very severe and pretty hard to treat sometimes.
I bet. I just want him to get well, whatever we can do to do that.
Absolutely, I understand that. We're gonna get this sweet baby some relief for you.
Thank you so much.
You're welcome.
I'm worried about what that biopsy's going to show when it comes back, but the most important thing for me is for Dilbert to get well. I want him to be the little dog he used to be before he got that eye infection. I want him to be Dilbert. Thank you so much.
No problem. He's a good boy.
I just have to call Dakota real quick. Then you can have your spot back, okay? You guys always take my spot.
I got the results back from Molly May. She's a cute little stray we saw a few weeks ago that had a really unusual hair loss problem. Hi, Dakota. How are you doing?
How are we all doing?
Dakota is handling her medical treatment while she's being cared for by a foster mom. So I'm calling him to go over the biopsy results. I've gotten some photos as to how Molly May is doing right now. How are things going?
So the skin is clearing up. She has no open lesions.
Good.
There's not a significant amount of itchiness going on.
Sites that she had her biopsies done, has that healed pretty well?
Everything looks great.
Good. I was worried about those lesions. That sounds great. So I do have those results. The good news is that they just basically saw a lot of inflammation and fibrosis and some scarring, alopecia.
I'm so relieved to find that Molly May does not have an autoimmune disease and that she's not going to require any long, extensive treatment. Her biopsy came back consistent with a disease called cicatricial alopecia, which is a very uncommon disease that can actually destroy the hair follicles and cause permanent hair loss. It's probably from whatever happened before. You know, we don't know exactly what conditions she was in before you guys came upon her. Even from like deep bacterial infections, you can get this scarring form of alopecia. And we could try her on a medication that would help with improving blood flow and help with wound healing and see if it might help regrow some hair for you.
Okay.
If Molly May's hair loss is due to infection, this hair loss may not be permanent. I'm gonna start a medication that's gonna take several months to start to work, but will help to improve the hair growth. I always want all of my patients to look perfect, but especially ones like Molly May that are looking for their forever home. Let me know if she has any trouble with the medication.
Okay. I will most definitely let you know. Thank you so much.
Sounds great, Dakota. Thank you so much.
No problem. Bye-bye.
Bye.
Is this Daisy?
This is Daisy.
Can you come inside with me?
It's okay, you can go. Daisy is hilarious. She has a personality. She's a talker. Hey, Daisy, you want to take a bath? You do? And it's cute to everybody else, but sometimes we tell her, you need to hush. All of my children are grown, and they'll tell you that she's the favorite.
We'll be right back.
When she likes you, she will walk between your legs. And she leaves her tail and her rear end right there for you to scratch. So everybody knows this. What's wrong with Daisy's tail?
Daisy, come here, huh?
The spot on her tail is pretty much black. It is a bare spot, and it's just very noticeable because it's right on top.
Daisy, look at you.
It has not affected her quality of life at all. But it started out small, and it's gotten bigger. And sometimes it flakes up, and that kind of worries me.
She's so pretty.
I recently had a spot checked on my face for my skin, so I thought it'd be a good idea if I brought her to a dermatologist and make sure that she gets it checked out as well so it doesn't get worse and keeps her healthy.
What's it look like?
It's really thickened, like she has plugged glands.
Mom says she does not bother it whatsoever.
She said it doesn't bother at all?
Yeah, zero.
This is where a lot of glands sit on the tails, and sometimes dogs will get like these kind of plugged follicles like this. And then also when she sits, she puts a lot of pressure on there, so it's just probably irritating it even more.
It kind of stinks.
It does smell bad.
It does.
It stinks.
Dogs have a gland at the base of their tail that's responsible for secreting hormones and scent. In Daisy's case, I think that the pores are clogged because of how the lesion looks. Something has to be really stenchy for me to be offended by it, and it's secreting a smell that indicates that it's probably infected.
I know that's gotta hurt your tail. Hmm?
Ooh. Uh-oh. Ooh, that was like a volcano. Yikes. I know. She's got blackheads, and then this toothpastey stuff is oil. Eek. It's gross. It's like acne. You have tail acne.
It's just not on your face.
Daisy's tail gland is infected, and so it's sort of like having backne, or in Daisy's case, tail acne.
Needs those pore strips. Gotta get a pore strip on your tail. I love stuff like this, so we could be here all day. She's probably like, what in the world?
Treating dog acne is very similar to treating people acne.
If you don't mind, Jackie, to just clean it.
Mm-hmm. And what's the most important rule of skin maintenance? To cleanse thoroughly.
All right, let's clean your tail.
She's going to clean this tail.
Just want to, like, turn her booty.
Go and clean your butt.
Look at that little scrub. Oh, now you got me wanting to squeeze these. There's not just one, there's like 30 of them. I mean, I could sit there and squeeze them all day. I just wanted to keep going. I think I've been around Dr. Joya too long. Look at that.
That's so satisfying.
I know.
Hi. What I think this is the oil glands that normally sit along the base of the tail are inflamed and enlarged. You know, it's kind of like acne for the tail. She has tail acne.
Who would have thought?
She's got, you know, white heads and black heads, which I was squeezing some of that material out.
I would have never squeezed it like Dr. Joya did because it did not look squeezable to me.
Yeah, you can squish it out like tube of toothpaste.
Wow.
You've never done this before. Apparently, I'm the weirdo.
No, but I would do it if I need to do it. Dog acne. Whoever knew there was such a thing?
We should treat this like we would treat acne in a human. I would start her on an oral antibiotic called doxycycline, and then I'm gonna get you an ointment that'll help to pull all that material out of the follicles called benzoyl peroxide gel. It's often used in acne washes that you can get over the counter.
Okay, sounds good. Well, I'm really happy to know that Daisy's gonna be fine. I will put the medication on it, and it should take care of itself. Well, that's probably the best outcome I could have wanted. Thank you, Dr. Joya.
You're welcome.
Daisy doesn't care if her tail's all spotchy. Just her mother does.
There she is.
So now that I know what it is, it probably won't bother me either. Come on, let's go. Come on.
I'm calling Miss Kristen, Puppy's mama now. Hi, Kristen.
Hey.
How are you?
How are you?
How's Puppy doing?
He's doing pretty well, but he actually just shed like 2 days ago, and it looks a lot better
Good.
now. But yeah, I've been keeping an eye on it and cleaning him all the time, so.
Yeah, well, that's perfect. I mean, you're doing a great job. Puppy is a 14-foot king cobra I saw a few weeks ago.
Oh my God, it's huge.
He had these suspicious growths on his skin, and I removed them.
That one really does look like a bunch of grapes.
I'm checking in with his handler, Kristen, to see how he's doing and to give her the results. I was calling to go over the biopsy results with you, and I have good news. There's no cancer. Instead, I found that these lesions were actually bacterial granulomas. A granuloma is the body's way of isolating foreign material like bacteria or fungal infection, and in Puppy's case, he had bacteria under his skin, and the body tried to wall that off. Definitely something that, if you completely excise them, shouldn't be an issue, and I think they peeled out well, so not having cancer in a, 25-year-old snake is great.
Yeah, that's great news. Yay.
Yeah. As long as they're removed and they're not causing any issues, I would really just watch them and know if anything comes back, but I don't think it's anything to really worry about for him.
Definitely good news. Yay.
Yeah, I know.
Well, thank you. We really appreciate it. Yeah.
Thanks so much. We'll talk soon.
Sure. All right.
Bye.
I brought Dilbert, my little Chihuahua, back. He has a skin infection, and he had a biopsy.
I'm gonna take him with me, let Dr. Griffin do her exam, and then we'll be back out.
Okay, thank you. Dr. Joy is going to recheck him to see how well he is doing and what he needs now.
Dilbert, how you feeling? Hi, buddy. I was so worried about you.
Dilbert's back today. He was in some rough shape when I first saw him.
Oh, his skin just looks so raw. Yikes.
His ear infection was one of the worst that I've ever seen, and I've seen a lot.
I don't even see the opening to his ear.
I did a biopsy that confirms that Dilbert has an autoimmune disease that's very rare called erythema multiforme.
Let me check his ears.
I'm hoping that his ear treatment has made a huge difference for him because he really needed some relief.
You ready? Good boy.
Time for the real test. So here we go.
Looks good.
Oh, there's much less crusting.
Yeah.
This is looking better.
Do you remember how rocks were in here?
Yes, we couldn't even put these Q-tips in his ears.
There's no more rocks in his ears.
So first the crusting goes away, then the hair comes back. Oh, I know. You just don't like it.
Yuck.
It's on its way.
Dilbert's ears are like night and day. Before, they had tons of crust that were closing up the ear canal, but now his ears are open. I can actually sample the ears without pain. That makes me feel so good for him because he's no longer suffering.
Erythema multiforme is a terrible disease. We're gonna fix you up. Okay, friend. Let me get some of these crusties. I know, I gotta get that one. I'm sorry, Dilbert. But it's so dry underneath. Oh, Dilbert. You're doing so good. I appreciate you. I really like this dog. You wanna come home with me? This is the stuff that I love. I just wanna pick all of this off. Look, these are ready to come off. Let's just get those off of there. Oh, see? And the skin underneath looks healing. It's healing nicely. He's like, please stop picking me. But it feels so better to get those crusts off, don't you think?
Dilbert's doing much better. His skin, it still has a little ways to go, but his ears have definitely improved, and that's life-changing for Dilbert.
You ready? Oh, you're so good. Go see your mama.
The plan is to taper Dilbert's medications, but I'm so happy to give him back to his mother looking this good.
Hi. This dog is so cuddly.
Please don't keep him.
I know. It's nothing like before. The sores are healing and he doesn't have new crust. I won't steal him from you as much as I want to. I'm sure he would love to be back in your arms.
Dilbert.
I don't want to give him back, but...
Oh, I know you don't.
Mom is ecstatic. She's absolutely the cutest lady. I think she's his biggest cheerleader, and having her on his side is really what he needs to nurse him back to health.
Say, I'll give you sugars.
You gonna give me some sugars? You gotta give me sugars.
Yeah.
She is determined to get him there, and I'm determined to help her get him there, so we're gonna do it.
Yeah. Oh, he's the best. Likely he's gonna have to stay on these medications for the rest of his life.
Really?
But my goal is to taper them down to the lowest dose. So hopefully we can get him off the steroid completely.
I'm so proud of him. He's such a tough little dog to go through what he has gone through. Oh, I feel so relieved. In his future, I think it looks bright. You know, I feel like going to eat a big steak somewhere. You know, give Dilbert part of the steak. I just love him.
Okay so far.
Why does she sound like a velociraptor?
Will you lift it up for me?
Stick up.
Stick him up.
Stick up.
I like this, though. The last couple patients have had some dew.
So cute. It's cute. It's bad to the bone.
Hey, guys, guess what?
What?
I got a video. I want to show you guys.
Who is it?
It's from Dakota. He's the one that brought the little dog, Molly May, that we worked on.
Kitty.
Molly May is a stray that has an unusual form of hair loss called cicatricial alopecia. But it's so speckled looking. It's interesting. I started on a medication to help improve blood flow and help the hair regrow, and I'm excited to see Molly today and if she has any new hair growth.
Here's Molly May. Months after she came to Dr. Joy and received some help. Her skin looks fantastic.
Watching you. So good. Oh, she had this scarring alopecia, yeah.
Is that all hair regrowth?
Yeah, she looks amazing.
You look so good.
Molly May's hair looks thick and full, and the scarring areas are very minimal now. I knew that there was a beautiful dog just itching to come out.
Her skin looks fantastic. She's getting adopted today, and she looks happier and healthier than ever.
Oh, good.
She got adopted.
Oh, so good. Every dog really deserves to have a forever home and have someone that loves them, and it's really wonderful to be part of that journey and see an animal that comes from looking very unlovable to this beautiful dog that she is today. She's so cute, and everyone's worked really hard to get her to where she is.
Good for her.
You should get ice cream to go treat.
She looks so much better. I'm so
Happy
happy.
she is. Look
Yeah,
at
she looks
that.
really good.
It must be your new yard.
Oh, cute.
Oh, look at that. How cute.
I am a foster myself, and so telling them goodbye personally is always a difficult thing. You grow very attached to them. But as long as Molly May's going to a forever home where she's going to be loved, then I'm totally happy to see her go.
He'll love that.
Oh, what is that?
It's a desk for Jeff. You know, he's like always hovering. He doesn't have a place to stand. He covets my desk. You got to earn the Rolly desk. He's 2 years out. That's what baby doctors get. Hey, guess what?
Was Jill over?
I got you something.
I'm leaving.
Come on, Jeff. I got you a plant. I know you've been wanting your own desk. I even got you your own chair. Here you go. Just try it out. You finish your residency, you can have a rolling table like me. It's comfortable, right? Oh, Jeff is so cute.
I'm not staying for these pictures. I don't have to.
It's already been documented. It's been documented.
I don't have to stand for this.
Cute. Oh, Jeff. Oh, is that itchy?
I'm Dr. Joya, and skin is my specialty.
Oh, your skin's peeling off.
When a mystery pops up, that case comes to me.
Let's start looking at you.
Things are looking better. This job can be sticky, gooey, and stinky.
Ew.
But I love every moment of it.
I love this. Amazing turnaround.
I've got Avalon with me. We call Avalon our special dog. She's just goofy, and she's fun to be around. She's like one of our kids. She's a joy to us. But she's got some kind of growth on her neck. It just keeps getting bigger. It's getting to where it's aggravating her, and she's starting to paw at it, rubbing her head on the ground. So we know it's bothering her.
You got Avalon?
Hey, this is Avalon.
Perfect.
Our biggest concern right now is to make sure it's not cancer. You ready, Avalon? And hopefully Dr. Joya can get it removed to give Avalon a little better quality of life.
Hi, Avalon. Oh, she's cute. Tell me about her.
She was going to be a service dog.
Really?
We have a service dog for a child of ours. My oldest daughter wanted a pet of her own. So we went back to the place that we got the service dog from, and they have some that fell out of service dog training. So they adopt them out. And Avalon was one of them. She's got Ehlers-Danlos syndrome.
Ehlers-Danlos syndrome?
Yeah.
Really? Does she?
They told us that when we was going to adopt her, she had that, and that's why she couldn't finish service dog training.
Ehlers-Danlos syndrome is an extremely rare condition. It's caused by an abnormality in the collagen. It can happen in dogs, cats, humans, I think even horses. And in those animals, the skin is fragile. It can tear very easily. I would say she does have a fairly mild case of it.
She's been great. We've had her
How
6 years.
sweet. And then she's got this big thing on the side of her head.
Yeah, it started out really small, and it just kind of morphed from there fairly quickly.
It's pretty big, huh? Like you have a little udder on the side of your head. Doesn't she scratch at it? It's got some erosions on there.
It's bled several times.
Definitely think it's something that should be removed if it's bothering her, even if it's benign. And things when they get big like that, you worry because it could be something that's serious.
Ehlers-Danlos is a congenital condition. It would not really cause a mass like this on Avalon. Usually masses are fairly common in older dogs, but when it grows quickly, it could be cancer, so we need to get it off and make sure that it's not.
Got a boob on the side of my head. Is it utterly amazing? Dun-dun-dun.
Good heavens, girl got jokes.
Look at Happy Puppy. She was gonna be a service dog. She's a service school dropout. Oh, she walks herself and everything. I love dogs that carry their own leashes. I think that is the most adorable thing. They're like, take me somewhere, I'll take myself.
I'm sure Avalon would rather be anywhere but here, maybe at home eating snacks, but we've got to get this mass taken care of today.
Okay, this is a very fibrous mass. It's got this outward extension of the mass, and then you can feel that it's knobby underneath, so it goes deep to about here. It's like a volcano. It's Mount Avalon.
This is a pretty large mass and it's pretty deep, so I'm gonna have to do a really good incision to get around it and underneath it to remove all of it. So there is gonna be a bit of bleeding, but it shouldn't be painful at all for her, but we gotta go deep to get it all.
I'm just trying to go slow so I can see what I'm doing and not have like a giant blood vessel pop out at me. Because you can feel it. It's about this deep. Yeah, I closed a couple little vessels on that side.
You really want to go fairly slowly with masses like this because you know that they're likely going to have a large blood supply. So I'm going to try to identify the vessels, tie them off, so that'll avoid having a large pool of blood that I'm then fishing through to find the vessels.
Feel under it on this side, so that feels happy. Oh, yeah. That's definitely more than the fatty tissue. This thing is gnarly. I almost have it out. I'm just like teasing these last few pieces. All right, I think it's coming out in about 10 seconds.
6, 5, 4, 3, 2, 1.
The pressure coming through that shower clamp.
There it is.
It looks like a
Jelly in there. Gross. Okay. Now you just have a giant cavernous hole to close.
Well, that's okay.
Deal with that.
Avalon's mass was fairly big, and in removing it, it was fairly deep, which left a pocket that I'm concerned may fill with blood.
I'm gonna place a drain because there's a ton of dead space from where this mass was.
If Avalon does have Ehlers-Danlos disease, this could actually make the pocket a little bit bigger and potentially fill more with blood. I'm placing a drain today to prevent a hematoma formation, which is when you have blood that'll accumulate under the skin. This will help to allow that fluid and blood to drain out.
OMG, we're done. Yes. Whew. It's tricky. Let me cut into this mass. It's like really thick. It's almost like cutting through cartilage. And it has this gelatinous connective tissue on the outside and like probably some fat. Feels very firm, kind of gristly. I got all of it, so that's good.
The mass came out easily, but there's 2 sections that are a little bit unusual.
You're gonna be a pretty flower.
It's probably benign, but you never know until you send it out.
Sweet girl.
Hey, Abby.
I had to place a drain in there so that it wouldn't fill with a hematoma. The wrap is just because it's draining, so it won't drain all over your car. When you remove the bandage, there'll be an incision about this long with sutures, and then there's a drain that's exiting at the bottom. It's probably a benign fibroma, and I did get all of it, but I am sending that mass out. It was very, very firm and fibrous.
Great. Thank you so much.
You're very welcome. You're very welcome. I'm glad we were able to help her. It was a pretty big thing there, huh? She needed to get that taken off for sure.
All right, Abby.
Bye, Evelyn.
Good job. Good job. Our biggest hope right now that there's not going to be any bad news. Ready to go home? You did good. You did a good job. We're just hoping and praying that it was just a benign tumor that just needed to go. When we get home, we're going to feed her real well, and I'm sure she'll be happy about that. I'm feeling really good. I think we gave her life back. Ready to go? Huh?
People kind.
Hi, buddy. Hi. Hi.
Nico used to be a very active dog. He was constantly bringing you a toy. He would wake up wanting to play. We wake up in the morning, he wants to play. We go to bed at night, he wants to play. Normally, he's dragging me anywhere we go. That's the difference with Nico now and Nico a year ago. We're dealing with a skin disorder that's kind of a mystery to regular veterinarians. Started on Nico's nose, and it moved slowly to his eyes, to his ears, and now it's just aggressively has taken over any exposed skin. So we thought we'd come see a specialist. We love Nico. Nico's a part of our family. He was our original son, you know. We have 3 boys, and especially with how sensitive the skin is, it's nerve-wracking being in a house with all those kids thinking they're gonna hurt him. You can see it in his eyes. He just knows something's not right. He just wants help.
I'm gonna walk you on back to the room here.
We want it fixed for him so he can enjoy the little boys again. It breaks our heart. Our family's not complete without Nico.
Honey, I'm so glad you're here. Oh, man. He said he's a gentle giant. All right, buddy, let's start looking at you. Poor Nico started having problems a year ago, and initially it just started on the face. It kind of extended. So he's got like some crusting on the foot pads, little erosions.
Poor little buddy.
I know, he's got lesions. Nico's a very severe case of crusting, and I can really tell that it's affecting his quality of life. There's 2 there. I'm gonna swab down in the ears too. I think Nico's dad feels that he's a pretty laid-back dog, but compared to most of our patients, he's very laid back, and I feel like he's probably not feeling as well as he should.
Oh, you don't like
Oh.
Oh.
Like
Oh, your skin's peeling off.
This is giant crust.
I know, it's okay.
His lesions look way worse than most infections. He's in very rough shape. I don't know, Amy, this one is really bad.
I know,
Here, sweetheart.
I know, it's okay.
Oh, man.
Nico has crust, and then he also has parts of his body where the skin is literally falling off of him. It's kind of peeling away. The skin that's left behind is oozy, and it smells terrible. If I don't do something fast, this is a dog that's not gonna make it. I know that the slides are gonna show me what's going on with him.
Can I swab you?
Oh, under that crust, yes.
Oh, it feels good, see? That's what I'm here for.
We could put this crust in it. Oh, don't lick it. Oh, he's trying to lick his crust.
No.
He is.
Gross. Ah! Well, at least it's got a lot of goods.
Okay. Oh, yeah, smush it in there. Gross. There you go.
Nico looks very suspicious for pemphigus, and this can cause painful pustules and crusts on the skin, what's typical of autoimmune disease.
This is a slide from the skin. It's just covered in bacteria. So I'm just seeing wall-to-wall infection. It is still a mystery as to the cause of it. I do think there's a very high likelihood that this is autoimmune.
Basically, autoimmune diseases are when the body just kind of makes a misstep and it starts to attack itself. This biopsy is going to be my only chance at getting a true diagnosis for Nico, and that's going to let me be able to get the best form of treatment for him.
Oh, it smells really bad. That's taking a lot coming from me.
I told you it was stinky.
I mean, any type of infection like that will kind of stink. I said he smells kind of like feet.
Oh, sorry.
Jill, don't start gagging, Jill. Oh.
I know what I'm smelling, and there's definitely something funky going on with Nico. It's just absolutely pungent.
Just kind of has that greeny look. What's weird is like why he would get infection there. Like it wouldn't do that with pemphigus.
On one hand, Nico has crusted lesions on his face and on his arms, but then on his belly, he's got moist, eroded skin, and then his legs are kind of swollen and weepy. Something's just not adding up, and he really is a mystery as to what's going on to cause all of this.
Good morning.
Come here, buddy. Come here, bud.
Yeah, we got him done. His skin is covered in bacteria. Just doesn't seem right. What's also weird is it's very uncommon to have infection that cause this degree of crusting. I mean, it's pretty unusual.
It is an odd case, so.
He's super odd case and he's miserable. Well, I think that's because there's autoimmune disease, for sure. I just don't know which type of autoimmune disease. We'll get an answer, hopefully. So I'm just not 100% sure what's going with him, but he worries me quite a bit. I do think we could do some steroids for a little bit.
Steroids are going to help to shut down this inflammation and hopefully give him some relief while we get to the root of the problem.
It's hard to watch him go through this.
It is really hard to see that with your baby.
You want him to be happy and healthy, and you do do all the procedures and do all the stuff, and we're trying to get him his help, and, he's our kid. The biopsies are being taken today to see if he's got an autoimmune disorder. We're just gonna start step by step, trying to, see if we can get a handle on the problem.
Hopefully we'll have this back very quickly for you, and then we'll give you a call with that.
He's such a good dog. It's excruciating. Yeah, just not knowing what's wrong with him. And whatever it is, we'll get it solved. Come on, sweet boy.
How's it going?
It's going great.
I'm doing a scope.
Oh, that's awesome.
Nailed it.
I gotta get that out. Confirmed mass.
Oh.
I've assisted Dr. Joya on lots of these scopes, and I'm definitely ready to take on one on my own.
You get a polyp out?
He's working on it.
Working on it. Don't say anything yet.
Did you get something?
Us. That's a piece of it.
I think it's on the left side.
I don't think it's even enough I don't think I can send that.
You want me to try it?
No.
Okay.
Not yet, not yet.
I absolutely want Jeff to succeed. I think he's very capable of doing a scope, but I'm here just in case he needs help, like a good mama should. Like I would with my own kids.
You can do it.
Thank you.
I believe in you, Pan.
I also don't want to, accidentally touch its brain. How deep do you usually go? Does it just depend?
I just dig deep and I pull and I say a prayer and I wish and I...
That was a little deeper. That was so deep!
You want me to try if you can't get it?
Okay, one try. I pulled half of it.
I'm gonna go see this case, do you want me to try?
You can try.
You want me to try it?
Yeah, it's better for the cat.
Okay, let's see.
Oh my God, but if you get this on one try, I'm gonna run out and scream.
You just kind of go in and then try to grab as deep as you can, really, because you're trying to get the base of it.
I wasn't going deep enough at all.
Really?
Yeah.
There it is.
It was a little bit painful to hand it over to Dr. Joya. It hurt my ego maybe just a little bit.
You got another one coming. You get it. You'll get it. Get it.
Dr. Jeff is an amazing and talented vet with a little more experience. He's going to do great at video scopes. It takes a while to learn this procedure. It's a little specialized. And that's why he's here, for me to help and train him to be the best vet that he can be.
Come on. All right, come on, come on. I know. You're excited. Snickers is a mama's dog. She's personal. She's a lap dog. She sleeps with me. She'll beg for treats. She does get green beans, and I do give her a little chicken strip as a filler to hold her over till supper. Cut her back because she's gained weight. I noticed a bare spot on her back. Popped up. I mean, it was just like she was shaved. And I didn't know why or how it would have gotten there. So I went to my doctor, and she checked her out, gave her an antibiotic and an ointment. When I put stuff on her back, though, she's kind of tender. And I noticed that it wasn't doing any good. It wasn't getting better.
Hi, Snickers. Come on this way. We'll get you into a room.
I hope that we'll find out why and what caused Snickers to have this.
I'm going to go get Dr. Joya. She'll be in a moment, okay?
And that we can get it treated.
This is interesting. This is brand new thing for her, right?
Yeah, she's never had nothing like this whatsoever.
Never. When did you first notice it?
She
like
had
a month ago?
3 weeks, almost 4. She had a bare spot and there's scale in there.
And did anything happen before this occurred?
She chases the cat.
That'd be a pretty bad wound for a cat. Plus, it's like multifocal. There's a little spot here, and then there's a bigger spot here.
I'm not sure what happened to Snickers. It seemed like she had a bald patch that then crusted, and it seemed like it was spontaneous. I have to really figure out what this is. It's really a mystery as to what's going on with her.
Is she itchy?
No.
Has she been lethargic?
No.
Okay.
No. She was overweight.
Okay.
She sneaks into the cat food.
Well, that's the weight then. My dog will eat anything.
I get it. We have to feed our cat up on a little kitchen stool to keep the dogs from eating it, but I doubt that this is a food allergy. I mean, Snickers is a little fluffy, but this lesion does not look like it's itchy. I don't think food and, too much chicken is the cause of this.
Was there anything else?
No, well, I mean, she got her teeth cleaned.
Teeth were cleaned, so about a week to 10 days afterwards?
Yeah, about 10 days, I noticed it.
Now this has me thinking that Snickers' recent dental may have had something to do with this lesion. I've seen dogs sometimes with injection site reactions and dogs that have had exposure to warm surfaces for extended periods get lesions like this, but I'm really not sure.
Well, I think there's a couple of directions that we could go. It could be an autoimmune disease where they start to develop inflammation underneath the surface of the skin and then they get wounds that you would see, or it could be somehow related to either an injection or the dental that was done. I'm not sure.
Because Snickers is not healing the way that she should, I have to consider autoimmune disease.
I mean, the only way for us to know for sure would be to biopsy the tissue right around here, which we can do today.
If Snickers' immune system is compromised, this could be leading to her body's inability to heal. But whatever's going on, I don't want her skin to get any worse.
We'll see what's happening here. Plot thickens with you, honey.
All right, sweet girl, Miss Snickers.
I'm gonna let Jeff look real quick, and then I do want a biopsy.
That's Jeff.
Hi. Just spontaneously happened?
Yeah, 3 to 4 weeks ago. Had a dental about a week prior.
What do you think, Jeff?
Drug reaction, injection site reaction.
Yeah, it could be injection site. Anything else?
Like vasculitis?
Could be vasculitis.
Sterile paniculitis.
Paniculitis, good. We're gonna biopsy it.
So it may seem like Dr. Joy is putting me in the hot seat or the kitty seat, which is okay. That's a part of learning. It's a part of the job, and it's ultimately to make me a better doctor.
Get in there. Go at the edge of the eschar, where the tissue's kind of inflamed. The skin's so thick here. All right.
Dab, dab, dab.
Beautiful. Nice job.
I'll have the results back in a couple weeks, and then I'll be able to have a plan to get her on the right treatment.
Here we go. All right. Everything went well.
Okay.
There's a chance that this wound could expand and get a little bit bigger because of all this inflammation that's there. So I'm starting her on a medication. It's fairly slow starting, but what it does is it decreases inflammation, and it also improves blood flow to these areas to help with wound healing.
I'm glad I went ahead and brought her in. She said it'd take 10 to 14 days for the biopsy to come back in to tell us just exactly what she has. Thank you, guys. I'm kind of worried about it, but I hope that Snickers should be in a few months better. That's a sweet girl.
Hi, baby. You good, baby? Are you nervous? Oh, it's okay. There you go. How are you?
Where are we, pretty girl? What's he got? There's Dr. Joya.
There you are. I get to see you finally.
Oh, look at you, little crusty thing.
We found out about Glory through social media.
Hi. Hi.
You want to say hi?
We saw her picture over the weekend, and we really wanted to reach out and help her.
A gentleman came home from work, and Glory and her sister, Tilly, were on the stoop in his apartment complex. They were in terrible, terrible shape. Eyes swollen, paws swollen, red, inflamed, bloody. You can tell they've been severely neglected. And he had posted on social media that he needed help, but he was not able to do this himself. And so they brought him to me. Tilly was probably about 4 stages worse than Glory. We had hospitalized Tilly because she had a really, really high fever, and she wasn't breathing very well. Her little body, the fight wasn't there anymore, so she passed away on Saturday. I apologize. But she's at peace now, and Glory's here to fight for her, so.
So sorry to hear about her sister.
Well,
It really
thank you.
stinks.
My biggest concern is that she potentially could get sick like Tilly did, and it could kill her. She needs to be better, much quicker. And so I hope Dr. Joy will be able to help her. Yeah.
She's got a little pot belly appearance.
Yes.
Oh, is that itchy? It is itchy. You just don't want me to hold your arm.
It's not unusual for pit bulls to have skin irritations and other kinds of skin problems, but with Glory being so young, I'm worried that she may have mites.
Her face seems to bother her the most.
It's where the heavy crusting is.
Yeah, when she scratches, when I said I'd take her out to the yard, she just dives in
your
her face.
Can I check your ears?
Stand still.
Can you check your ears?
You know, if she was very itchy, it's possible that she might have 2 types of mite. Demodex mite and then scabies, and that can cause a lot of crusting on the ears. If Glory has Demodex mites, those are a type of mite that live deep down in the hair follicle. If she has scabies mites, those are more superficial in the epidermal layer. Both mites can cause itching. With scabies, it can be really severe. With Demodex, the skin can become itchy, peel away, bloody. So either way, not good news for Glory. I'll scrape her for both mites. Glory's constant scratching can lead to sores on the skin that then can be secondarily infected. Glory's situation right now being so debilitated, her body cannot fight off infection like that. So I've got to get to the bottom of this and figure this out right away. I'm not going to let Glory go down the same path as her poor sister. This is one of the worst cases of mites I've seen in a long time. There's just a lot of infection. I'll take her in the back to scrape her.
See if we can find some mites. You a mighty girl?
It'd be really rare for a dog Glory's age to have an autoimmune disease. I think I'm probably dealing with something a little more common, and I'm gonna get to scraping for mites.
All right, I'm gonna do a deep skin scrape first.
Hey, puppy. That's a good puppy.
Her skin is like elephant skin.
Can you imagine what this must feel like?
It's gotta feel terrible.
Oh, wow, she's got that crust, that good crust.
Crust going up.
Yeah.
How many skin scrapes have you done?
Well, I'm trying to do superficial and deep.
If Glory has 2 different types of mites, I'm gonna look closer to the skin surface for scabies mites and deeper down for Demodex mites.
Stain these slides for me.
Ooh, shake it off.
Shake it off.
Oh, gross.
Do what you gotta do, Glory. If you gotta shake it out, I'm here to support you. Whatever you wanna do, I just wanna help make you feel better.
Which one did you find? Both?
Nothing yet. This is the superficial scrape. I'm trying to look for scabies mites. No, scabies.
The superficial scrape is negative for scabies mites, which is good because that is an extremely itchy mite. Dogs feel very uncomfortable with it, and it's also contagious, and that's just not good for Glory.
This is a deep skin scrape. That's why it's red, because I scraped until I got capillary oozing. And we have, this is a Demodex mite, a dead one. Looks like there's one there. So those are both dead, like pieces. Some immature mites, as well as some adult ones. Yeah, she's got quite a bit. Here's another one right here. Oh, see its leg? So there's still some that are alive.
Glory's deep scrape is consistent with Demodex mites, and she's covered with them. But that's okay, because this is easily treatable.
Okay.
Are you peeing? Now you're peeing. You picked a good spot.
She's
It's going right in the sink.
What a good girl. That was a good girl. She kind of knew.
Got really close.
You ready? All right, say hi, I'm back. So these little red raspberries are where I did the deep scrapes, and then I did a superficial skin scrape to look for scabies mites. I didn't see any scabies mites, but definitely Demodex mites are there.
I'm glad that Glory's here today. She has mites, which can be a very severe infection in young dogs. And Glory lost her sister recently because she had several different things going on, and the mites were a compounding factor to that. So it's really important that we get her back to a clean bill of health, because otherwise, you know, we could have some disastrous outcomes for her.
Within a month, she should have a lot less crusting, hopefully none.
Awesome.
And then, you know, the hair will start to grow back after that. That's gonna be the part that's gonna be slow. You sweet girl. Get you looking pretty, huh?
Yeah,
looking glorious.
I'm glad we didn't hold off on coming in.
Thank you all.
You're welcome. Have a great day.
You too.
I would absolutely love for her to get healthy, find that amazing family that she deserves to be with. Every dog deserves a second chance, and Glory deserves about 10 chances.
You have to be sleepy.
Hi.
Hello.
How are you? I'm good. How are things going?
She's doing very well. Been very active, more so than before.
She feels good without having the cousin it on her face. Avalon was here a few weeks ago. I removed a giant mass from the side of her face, and I sent it out for testing.
This thing is gnarly.
And I placed a drain so that we wouldn't have a fluid pocket underneath where the mass was removed. I'm calling her dad today to check in and see how she's doing and to give him the results. I've been in communication with your family that once she pulled that drain, healed really well. Like, she sent me a picture and it looked good, but even seeing it today, it looks even better. It looks great.
Yeah, it's healed up great.
I was calling you, too, to tell you the results of the biopsy.
Oh, yeah.
Yeah, so it came back, it was all benign, nothing cancerous, so that's the most important thing. And then she had this outgrowth. That was consistent with a dermal fibroma, and then in the deeper sections, they actually found another type of tumor called a trichoblastoma. So it was sort of two different tumors.
Oh, wow.
Cool. Nerdy.
Yeah.
Avalon had two different tumors. She had a dermal fibroma, which is a benign tumor that comes from the skin, and then she also had a trichoblastoma, which is a benign tumor that comes from the hair follicle. And one was actually growing inside of the other, so it was really neat.
We're just very pleased with the outcome.
Good, good. Well, I'm so happy to be able to help her.
Thank you so much, doctor. You have a blessed day.
You too. Bye.
Oh. His nose is bleeding.
His nose is bleeding?
It's like, oh, it's all over me.
Oh my God. Look at this.
Look at me. Remember my rant against white coats? This is why.
So should you have a bloody red coat?
We could do navy, we could do
brown. We deal with a lot of poop. Brown coat.
Is it better to use peroxide or this is peroxide sprays?
Blah, 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 blah.
That's a lot of spray.
Oh, there's so many dots. I only have one white coat, but it's not working. I'm just gonna burn it. I give up. R.I.P. jacket.
Hi. How's Nico doing?
He's okay. He's doing all right. You want me to turn and you want to see him?
I would love to see him. Yeah, absolutely.
All right, let's flip this phone around here. There he is.
Oh, your skin's peeling off.
Nico's a German Shepherd that came into us a few weeks ago who had been suffering with a terrible, mysterious skin disease that just wasn't getting better.
He's in very rough shape.
I started him on a steroid. I'm hoping today that he has improved some since that first visit, and I'm going to report the biopsy results to the parents. Is his belly still very oozy and sore?
Actually, it's not. It's not oozy and sport. It's still a little irritated and it's got some black to it, but it's completely almost lost the smell and the ooze to it. So
Well, that's good, because the smell and the ooze were...
Come on, look at him getting up though. I mean, he's getting up, moving. Come here, bud.
I have his biopsy report right here, so I wanted to go over that and then talk about what we need to do long term for him, because he's actually a really tough case. I'll get to the punchline first.
Okay.
So he has pemphigus, which is what I thought from the crusting on the nose and on his ears, but he's got a lot of things going on. He has 2 different autoimmune diseases.
Oh, gosh. Okay.
So he has pemphigus, but that moist, oozy skin on his belly, those areas look like they're more consistent with erythema multiforme, which is a completely different autoimmune disease. I'm not often surprised by the results from my biopsies. I usually have a pretty good gist of what's going on, but with Nico, I mean, he's one of the few cases I've ever seen with 2 autoimmune diseases. Erythema multiforme is an extremely rare skin condition that can be triggered by infection, and Nico's skin at the last visit was covered with bacteria, and so it's possible that that initiated this disease process, and then the body just started attacking itself. I mean, bad news is, who wants 2 autoimmune diseases? I mean, it means that he's likely gonna have to be on heavy immunosuppressive drugs long term.
Yes, ma'am.
But the good news is that you might get lucky and be able to treat both of these diseases with the same drug protocol. So I'm hoping that that's what we can do. It's very rare to have 2 different, very challenging to treat autoimmune diseases, but I can see that he's had some improvement, and we at least now have a diagnosis. For me, this is not enough. Like, I want him to not have any sores on his skin whatsoever. So I'm gonna try to do what I can to make him better as much as I can for as long as we can. Well, I wanna get you your dog back, you know, but I'm pretty greedy. Like, I want him to look perfect again.
That's okay.
You know, the sores that he has, I mean, even though he feels better right now, like, we need to get those better.
Before this, we didn't know what it was.
And you guys are amazing. You're dedicated to him, which I truly appreciate. So we'll get these medications and see how he does.
When I brought him to your door, he was on death's door.
Yeah.
I don't shed tears often, but I about cried.
It definitely hits close to home, so it's hard because people always will ask you, you know, what would you do if this were your pet? And I've been there, and I've done everything. Like, we have, you know, walked through high or hell water for our animals, and this guy is trying to do that as well. Well, thank you for being committed to him.
Yes, ma'am, thank you. Thank you for your help.
They're doing everything that they can to try to keep this dog here. So I'm gonna try to do the same for them.
I'll let you walk. All right, now we're going. This way, sugar. Come on, this way, baby. Here we go. Let's go over here and sit, babe. Well, I brought Snickers in to get her back looked at again. I'm looking for good news, but I'm a little bit of concern. I don't think she's back really 100%. Take a step on in there and have a seat. Here we go, baby. I hope Dr. Joya says Snickers is gonna be fine.
How are things going? That looks better. It's getting there.
It's getting there. She got her
That big
stitch.
scab is gone, so that's
Yeah,
perfect.
it came off yesterday.
Okay.
Snickers is back. We saw her a few weeks ago. She had a spontaneous lesion in between her shoulder blades on her back that wouldn't heal.
She had a bare spot and the scale in there.
Was there anything else?
No, I mean, she got her teeth clean.
After prescribing a medication that helps with wound healing and blood flow, she's looking great, improving, and I have biopsy results today.
The biopsy results, I did get those back. There was no cancer or anything concerning like that.
Good.
No evidence of autoimmune disease. 'Cause I was a little worried about an ongoing autoimmune disease, but it doesn't look like that's the case.
Oh, my goodness.
But it seemed like it might have been, what they called it was an ischemic dermatopathy, which is a fancy word to mean that there was basically lack of blood flow to the tissue here.
Ooh, really?
Which can happen with vaccine reactions or injections. So I don't know if something was given there and that for whatever reason her body just did not like it and it caused inflammation in the vessels and then the tissue died, basically is what happens.
Ischemic dermatopathy is a disease that causes damage to the blood flow to a certain area of tissue. And because of that lack of blood flow, the skin won't heal.
What I was gonna do is get you some more of her, the anti-inflammatory medication. It's slow starting, so it takes 3 to 4 weeks to really start kicking in. I think we're gonna need at least another month beyond the first prescription that you have to get this fully healed.
In a few weeks, Snickers' wound should heal and the hair will regrow, and this is such great news for cute little Snickers.
Thank you. She's wonderful. You're welcome. I'm glad we could find out the answer, and now we know we're on the right track.
Yeah, we are, and it's helpful.
Already it's looking so good.
I'm not worried any longer. I can rest now. Best news I got. I would have given her the biggest hug I could, but she was playing with the dog. Snickers. Awesome. Did you hear that, girlfriend? You did. You're okay. Snickers is gonna be fine.
Oh my God, look at you.
I know, she's like a different dog.
It is a totally different dog.
Yes.
Glory. She's a brindle.
Oh, yeah. She's got the prettiest
You have
brindle.
hair. Look at you.
I cannot believe this is the same dog. She looks completely different to me.
She grew hair like a chia pet.
I know.
Glory was here a few weeks ago. She had recently been rescued along with her sister, and her sister unfortunately didn't make it because of her weakened immune system. And Glory herself was also in very bad shape. There's just a lot of infection. It's gotta feel terrible. Glory was loaded with Demodex mites, but after treatment, look at her now. She looks great. She's got a full body of hair. She's a brindle dog. Who knew? Like, she looks amazing.
Aw, so soft.
Oh, what a happy thing. How's she been doing?
She's been doing wonderful. She's
Good.
not even been real itchy.
That's good. She's still got some crusty spots. What I'd like to do, scrape and pluck a few areas and make sure all the mites are gone.
It's great to see Glory looking the way she does today, but I have to make sure the mites are completely gone.
Sweet
girl. What a question. Okay, puppy. Puppies, once they come back after their Demodex, they are hard to scrape.
I gotta scrape it, okay?
Give you a little red raspberry, just a little one. All right, it's so hard to do. This is from the top of her head. I did take a slide from there because she's got these little crusty scabs. I'm looking through these skin scrapes. All right, let's see. Do we still see mites? Big money, big money, big money. So far, I'm not seeing any mites. Not yet. Not seeing any mites, so that's awesome for Glory. No mites for you. She's cured.
Yay! Feels great to be able to give Glory a chance at living a long, happy life. She was miserable, so to be able to get her back to health is amazing.
She's so cute. So the good news is no mites whatsoever. So that's excellent news. I mean, she's like a brand new dog.
I love seeing this transformation from a dog that looks horrible, where there's not any hair on its body, it has sores everywhere, to a dog that looks amazing again. That's why I became a dermatologist.
Are you looking for a home for her, or are you gonna keep her?
No, she will be getting adopted out.
Okay.
We've had a lot of people contact us about her. I think her future is bright. She feels good. She's just your typical 15-week-old puppy now. Come on. Glory has a pretty big group of people rooting for her. I think that perfect family will come along that loves her as much as I do. Come on out. Glory. Come on.
He is so funny.
Well, who are you talking to? Oh. Ah, what a good baby. Did you do good?
Come here, buddy. Come here, buddy. Come on, sit down. Come on. Sit down. Come on. Sit down. You're all right. Sit down. Come on. You got it. You got it. We brought Nico in here today. We're just gonna kind of do a follow-up. We're really excited for Dr. Joy just to see him.
Hi, Nico. Hi.
Well, come on. Look.
Look at you.
Look how fast he's hopping up.
I know. Look at all that fur.
I know. Look at him. It's all coming back. I know. He's doing great. He's gotten his hair back. He's gotten his energy level back. It's my dog again.
Hi, Nico. Look, you do look so much better. Look at you, baby.
It's incredible to see him doing so well and his life improving. When Nico first came in, he was so lethargic, he could barely move.
Oh, your skin's peeling off.
Just kind of has that greeny look.
It turns out that Nico had not one, but 2 autoimmune diseases that were attacking his skin.
I don't know, Amy, this one is really bad.
I've been treating Nico with a combination of high-dose steroids and immunosuppressive type medications, and I'm pleased to see that his body is finally making a turnaround.
We got our dog back. You gave us our dog back.
Oh, that's so awesome.
We appreciate
This is
it.
almost all the way better. She said that the belly wasn't as gooey.
No, it's
Just a little red. Oh, it's almost
just,
fully hit.
yes,
There's a little spot
There's
there.
this patch there. Yes, ma'am.
Nico looks amazing today, but I'm pretty greedy. I want him to look perfect and not have any lesions on his skin.
Let's see. Oh,
And
okay.
we will. He'll lead.
I'm out.
Yes, ma'am.
I'm gonna stay on top of everything, no matter how small it is.
So he's got some little,
He's a barrel.
2 erosions on the side. Sure. That haven't healed yet, but compared to where it was, he smells, but only a tiny bit.
Oh, your nose feels better too. Doesn't your nose feel better?
Yeah, he says he gets up and he actually plays.
Yeah.
Looking at how much Nico has turned around since we started seeing him is just absolutely amazing. And it does reiterate the fact that Dr. Joya really knows what she's doing. She just seems to work magic on some of these patients.
There's still a little bit of bacteria.
There and there and there and there.
All right, so we do need to keep going with the antibiotic.
Nico is gonna have to stay on some form of medication for the rest of his life, but that's the trade-off to give him a good quality of life, and that's all that matters.
All right. Today was an easy button visit.
That's okay.
Everything looked really good. He just has those open areas. I want to keep going with the antibiotic until we can get this healed. And then we're going to start to peel back the steroid a little bit. But he looks great.
You looking at your dog watching something like that happen.
hard
Watch
to
him
see him
deteriorate like that,
Yeah, and
we
it's
didn't
hard
know
to
what
see
to
him-
do. We
hard to
didn't
see
know
him
what to
suffer
do.
like that.
Yeah, of course.
Thank you for sticking with him and for bringing him into us and letting us help him out.
Yeah, thank you all. Dr. Joya is amazing. She fixed our dogs. We're back to throwing sticks. We're back to playing in the backyard. We're back to, running around and having fun. Never thought it would happen, knowing how he came in here, but he's on the road to recovery and he's got a lot of life left to live. He's got a lot of people that love him and care about him, so,
What is your favorite yoga pose? I like pigeon, but I'm not good at it.
I need a visual demonstration.
Are we centered?
Well, I don't know about that.
You guys really got me doing things.
I'm not sure that's pigeon's pose, but whatever.
Yeah, you're on your own with that one. I'm not gonna do the pigeon.
Now your turn.
That's all you're getting out of me. You know what? Here we go. I got it. This body ain't built to stand. It's built to roll, honey.
Oh, is that itchy?
I'm Dr. Joya, and skin is my specialty.
Oh, your skin's peeling off.
When a mystery pops up, that case comes to me.
Let's start looking at you.
Things are looking better. This job can be sticky, gooey, and stinky.
Ew.
But I love every moment of it.
I love this. Amazing turnaround.
Where you going? Bean dip is special to me. She has this really funny mouth. It looks like she stuck her face in a pile of bean dip, right? Bean dip is 10 years old. She loves to sit by you and have you brush her. She's recently taken over my dog's dog bed. She lays in that like a princess. She really is kind of a diva. The shelter posted a picture of her, and that was it. She was just so funny looking, and I also knew that she probably didn't have much of a chance at the shelter. So many people just want good-looking cats, young cats, kittens. Bean Dip does have some medical issues. She has a few lumps. She has one in her neck that's covered in fur, and then there's the cyst on her head. She She has had these things for 4 years. I feel so bad for her because she has such a pretty face. Well, this is her cyst. It's soft. Over time, it's gotten a little bit bigger. She itches at it, and sometimes it does bleed. Bean Dip is going to see Dr. Joya, and if it could be removed, that would be great. It's not just a cosmetic thing, because it does bother her. I just really think that she deserves to feel as good as possible because she's had a rough life. You ready, Dippy?
Get you guys into a room.
Okay.
Hi, good morning. How are you? I'm Dr. Joya.
Bean Dip. Hi.
Let's see what's going on with her. So there's a little mass on her face.
Mm-hmm.
I see that. Has it been bothering her?
Yes.
Yeah. Does it bleed?
When she scratches at it.
Hi, sweetheart.
It's okay, Bean. It's bigger than it was.
It's very cystic seeming. We can definitely get that off for her. But what I was noticing, she's got chin acne. Let's see what else you got going. She's like, okay, just move me around. We got another one right here. This one is a little bit blue tinged, but sometimes these are sweat gland tumors.
Cats can have all types of tumors on their skin. The best way to know is to cut it out.
As far as for the masses, we can definitely get those taken off for her, especially the one on her head, since that one bothers her the most. Yeah, I mean, they feel similar. Like this one could potentially be less fluid feeling. I think it is a good idea to send them out, because then we can get a true diagnosis on what they are.
Owning cats and dogs, you're always worried about cancer. What are the chances this is something
cancerous?
Yeah.
Most tumors that are on the skin are benign in animals, but I have seen some being aggressive.
Any mass on the skin could be cancerous. I'm a cat owner myself, so I understand why Mom is really worried.
Let me get things ready for you, and then we'll get her taken care of today.
I've lost 5 animals in 4 years. 2 to cancer. If Bean Dip has malignant cancer, something really vicious, we'll be able to give her tons of attention and tons of love until, you know, it's time for me to let her go.
I'll take good care of her. Hey, girl.
All right, little poke.
While the sedative kicks in, I can give Bean Dip a little spa treatment. That discoloration around her mouth and chin are actually clogged pores, so I'll clear up some of that.
I know. You want to pop them?
Do it. This is what I like.
She needs a facial. Oh, there it was.
There it goes.
I do a lot of gross things.
Wow, that's so gross.
It's fun. I like that you can just get all of the pus out. It's extremely satisfying.
You want to do some, Jeff?
No, I do not.
You respectfully decline?
Thank you so much.
Dr. Jeff is a young veterinarian who's doing his first-year dermatology residency with me. So I involve him in as many cases as I can.
Oh, nice.
Dr. Joy is great. I appreciate her getting me hands-on, but those blackheads are fine right where they are.
You're good?
Yeah.
She may or may not have had me pop a blackhead for her.
That feel better? Kind of?
All right.
Removing blackheads is my guilty pleasure, but as soon as she's sedated, these masses have to go.
All right, we're gonna now take the mass off of her neck. Sometimes these things are infected hair follicles, and if you cut into them, then you end up with all this goo. We'll cut it out, and then we'll cut into it. I don't know what texture will be inside of there. It's peeling out really nicely, which makes me feel really happy. There it is.
Will you cut into it after we're done?
Yeah.
Part 1 is done, the mass is out. I'm stitching up the skin, and Bean Dip is comfortable. And now comes the fun part.
All right, let's see what's inside of this thing. Whoop. Ew, see? That's why I didn't want to cut into that before I removed it. How nasty is that? I think it's a sweat gland tumor, but we're gonna send it out to confirm that. They're usually fairly clear in color.
Believe it or not, cats really do have sweat glands in their skin. They don't really sweat from these sweat glands. They secrete an oily substance that acts as a pheromone. Cats do sweat, but mostly on their foot pads or on their noses.
All right, and this one's gonna be a little more delicate because it's near her face.
Ooh, your skin is so tough.
What do you want me to do?
And this one's smaller. We can deflate it and then...
Yeah, stalk's not very.
All right, here it comes. What?
That was more like blood.
The mass on top of Bean Dip's head is probably also a sweat gland tumor. It contains blood. Could be that the mass was a little bit more irritated and there's less fat in that area as well, so maybe that's why it looks more like blood.
Now it's a little raisin on your head. That'll be easier to pull out, though. This one looks a little, it's all deflated now.
What the hell's this? Oh my. Hey, Joya. That cat's got a big hematoma under the skin.
Oh, no.
Or she hemorrhaged.
On this side?
Yeah, see?
So I'm gonna have to cut the suture out, and then I need the little cautery.
The side of one of Bean Dip's masses is now oozing and filling up with blood. So I have to go back in and find this bleeder.
I'm gonna have to open this all the way back up. Where is the bleeder?
I think it's up here. That's right there, you got it.
Anytime you remove a mass from the skin, there's always a chance for a little extra bleeding. But we caught it right away and took care of it, and Bean Dip won't even notice it.
That does the trick.
Okay. We're trying to help you, little Bean Dip.
Hi, girl. Don't bite me. Be good.
You're okay.
Please don't pee on me, okay? Because you already did.
The masses are gone, Bean Dip is comfortable, she's awake now, and she's ready to go back to her mama.
Here she is.
I had a little bleeder. This is just a light bandage.
I'm pretty excited to see Bean Dip awake. She actually looks really good for what she went through.
We took all 3 of those off. They all are cystic. This one was a little more infiltrative, so that's why it's oozing a little bit. If one was gonna be more interesting, it'll be this one here. And then we are gonna send these out to make sure they're not cancerous.
I'm pretty confident the masses are sweat gland tumors, but the one on the neck was a little irregular. It was a little deeper, so I want to be sure. Safest to send it out.
She's gonna feel better, I know it. Thank you so much.
You're very welcome.
Yay, Bean. They'll get the results, I think, in about 2 weeks. You know, I feel a little bit lighter, but then I still have these 2 weeks to wait for the results and just hope that they're benign and it's nothing bad, nothing terminal.
Okay. Hi, baby. Look at your little chocolate dip nose. Hi, you Snickums. Hello. Hi, Miss Gemma. Hi. Say, I'm the sweetest.
She is.
Girl.
I love this dog.
I can bring you and Squirt along this way, and we'll get you settled in an exam room.
I brought Squirt to see Dr. Joya.
Well, come on down this way.
Squirt, he just looks like a squirt. He's just so energetic, and he has so much life in him. He loves to play. He loves to run around with his brother Sprite.
You guys ready to go in the water? You're a fast swimmer.
He's not as energetic as he used to be. Squirt has a problem hearing right now.
Hi, baby.
We started to notice as we were calling Squirt's name that he just wasn't listening to us. It makes us sad that he doesn't know things are going on. I can walk in the back door and Squirt turns around and walks away from me and doesn't even know that I'm there. We have to make hand gestures for him to see us.
Come on, Squirt. Go with her.
And it's progressively gotten worse to the point where he could be 2 to 3 feet away and he doesn't hear us.
Good boy.
I'm hoping that it's just something simple that we can solve. The only worry would be that Squirt's gonna continue to be deaf for the rest of his life. You know, we're just hoping for the best.
Look at this little Squirt.
Today we have the cutest Cavalier named Squirt coming in for his first visit.
Hi, you're so friendly. Why is your name Squirt? That's so cute. Is it because you were, a little squirt?
Did she say which ear was bothering him more?
It would be very unusual to walk into your human dermatologist and complain about ear disease. But in veterinary dermatology, the ears are a really important part of my practice. The ear itself is really just a glorified tube lined by skin. So diseases that affect the skin will often affect the ears.
So Mom said he has been hard of hearing for like 2 to 3 years and has had a couple ear infections.
Okay, I'm gonna have to swab your ears and then I'm gonna have to look in your ears.
Okay, I'm gonna just hug you and squish you.
Okay, ready? Look who is so brave. Okay, there's not much going on inside the ear. There's a couple yeast in his ears. Nothing crazy.
I don't see any bacterial infection, and certainly a little yeast is not the cause of Squirt's hearing loss. If I'm gonna solve this mystery, I need to take a deeper look.
How quickly is it to hook that scope up?
You wanna do it?
Yeah.
You can use this scope without having to put the animal under anesthesia if you're very fast and you have a very tolerant dog.
You ready? Okay, you keep looking at me. He's the funniest little dog. It's hard because he doesn't have much of a snout to hold. There it is.
I see hair. It's a bulging.
It's a bulging.
Squirt is here with a several-year history of hearing loss, but I think I know what's going on. I'm seeing that the eardrum is definitely bulging, it's thickened, and it's coming towards me in the scope when the eardrum should normally appear flat.
All right, can we see the other side real quick?
You're okay.
He may have lost his cavalier minutes.
What are you even doing?
He's playing dead.
Please let us look in your ear one more time. Come over here.
He doesn't want us to do it. All right, one's ready, quick. I may not be able to get just a chance to look at this
Look at
one.
me. It's okay.
No, he won't.
It's okay.
It's okay.
It's all done. It's
We
all
know one
done.
side is bulging for
You
sure.
are done.
Maybe the other. Okay, you did it. Take a breath.
Squirt is not letting me look down in his ear canal, but I'm pretty sure I know what's causing the problem.
Hi. Your dog is so cute. He's the sweetest thing. Look at this personality. So your vet had told you that they saw his eardrum was bulging?
Yes.
It is, for sure, on the left side. And the right side, I couldn't tell. He wouldn't let us. But that's what it looks like. Cavaliers, they get this mucin buildup in the middle ear, and it will cause the eardrum to bulge out like that.
Squirt's bulging eardrum is almost certainly a condition called primary secretory otitis media, or PSOM for short. It's a disease that's predominantly found in Cavalier King Charles Spaniels. The disease causes mucus to build up behind the eardrum and cause it to bulge, and the dogs will experience head tilt, balance issues, pain, and hearing loss. It's a treatable condition, but Squirt will have to undergo a procedure to release pressure behind his eardrum.
There's really no way to get it out other than doing a video scope. So we just stick a little hole in there and then we flush that material out. It's really cool, actually. As soon as you puncture the eardrum, it just sort of pours out. And hopefully that'll help relieve all that pressure and then restore his hearing.
We learned a lot today just listening, and although Squirt couldn't hear anything that was going on, he was very excited.
Bye, sweetheart. You're so sweet.
In a month, he's gonna come back and they're gonna perform a small little slit on his eardrum. I know, sweetheart, I know. And once she's done, hopefully he can at least hear something again and have a better life with his 2 brothers.
Jeff, do you want to cut into that mass?
Not really. Oh, I can.
We each have our different things that gross us out, but Jeff is an easy target.
I'm not gonna do that.
Do it, do it, do it, do it, do it.
What's with the peer pressure? We're not in high school anymore. Where's my support?
Don't you want to see what's in there?
Not really.
The learning process
This is for you.
I'm glad you're doing it for me.
The more often I can sick him out, the better. Especially nasty things that are gonna kind of pop out of something he's not a fan of at all.
I'm so scared.
Just poke it. You nervous?
No, I wouldn't say nervous. Maybe nauseous.
Is it brown?
It's brown. Oh, it's so juicy.
Yeah, this one was grosser.
I'm so unhappy.
I don't know how you're in the field of dermatology not liking gross. I mean,
I've gotten this far as a regular veterinarian.
really? Well, regular veterinarians don't do this all day.
I don't know what to
All
tell
we
you.
do is gross.
Oh, Hazel, come guys. We're going in that fancy hospital. I brought Hazel and Lola to see Dr. Joya. This is pretty cool, huh, girls? Come on, Lola. With Lola, she has a lump on the top of her head. Say hi, we're here. She's a sweetheart. Lola's my girl.
Hi, how are these babies?
Hazel and Lola, they came in together. They're sisters, but unrelated, sisters from different moms.
So Lola looks more like the Labrador.
Yeah.
So tell me about her.
Lola's been with me for about 10 years, and Lola is not fond of strangers, but for me, she'll do anything. Come on, Lola. She has a lump on the top of her head, and it's soft. She's an old dog who prefers just to pretty much sleep all the time, but this keeps her up for hours because she's got to scratch so much. We're bonded, and I just hate to see her suffering unnecessarily.
How long's that been there?
It's been there for a while.
Okay.
And it's getting bigger, but it's not in leaps and bounds, you know, just gradually.
Yeah, gradually over time.
I'm worried that it might be cancer.
It does feel a little bit cystic. Some kind of material in there. Never know what lies below.
So I'm feeling this mass. I don't know for sure what it is, but the only way to know is to cut it out.
We could take the one off of Miss Lola's head today. It would look like a big incision, but these are fairly easy to remove.
Okay.
All right, well, it'll just be a few minutes, okay?
The older animals get, the more lumps and bumps they can get on their skin. Some of these could be benign, but some could also be concerning.
1, 2, 3.
I'm hoping this is a non-cancerous tumor, and there's nothing to worry about at this point.
Are you gonna go see this?
What do you think?
Good to me. All right, Joya.
Ready?
I'm ready when you are.
Large and in charge old mass on here. Cut it out. Ooh, I like how this is peeling out. I am suspicious. There's some goo in it.
Are you kidding? Joya!
I really wasn't expecting that. Did it get you or just me? Is it in my hair?
Yeah, it sure is.
I almost just have it, and then it ruptures and squirts me in my head.
Is it a bleeder?
No!
It's sprayed.
White scotch.
You quit squeezing it.
It squirted in my hair. Can you get it out?
Look, you got new hair gel. Hold still. Close your eye. It's little specks everywhere.
This is not the first time, unfortunately, that Laura's removed something gross off of my face, hair, and eyes.
So cute. That stuff sticks, and it stings, and it stays forever.
Oh, Lola. Here it comes. Just tease it out. Just peel it out like a... I don't know, what things do we peel out like this? I don't know.
Here, I got you.
This is the mass that squirted in my hair that lived in the house that Jack built.
Paper towel. Yes.
Okay, let me deal with that later and then close her giant hole in her head.
I've removed a lot of masses, and this one is a pretty good sized one. So removing it, Lola is gonna feel a lot better. As for me, I'll feel better when I get home and get a shower.
Clean up, clean up.
Want to turn her off?
Yes, we can.
I can't wait to see the nasty stuff that's inside of this mask.
This is a large cyst. What you got in there? Oh, yeah.
Ooh, it looks like hair.
There's a lot of white, kind of toothpaste-y material. It's very thick.
Looks like like rubbery. Cool. Wow.
It looks pretty consistent with sebum, the material that's produced by oil glands, and then there's like little pieces of hair in it.
That's so gross.
Fortunately, I can tell this mass looks non-cancerous, and Lola's gonna be just fine. Hopefully she won't grow cysts that pop in people's faces in the future.
Here she is. She's a little groggy, and everything was fine.
I feel much better. I was just afraid if that was cancer or anything, and now at least I know that it isn't, and that once it heals up, she'll be fine.
I'm gonna help you down these stairs, okay?
On the way home, we'll stop somewhere and make sure she gets a hamburger for being such a good girl, and so will Hazel, and of course, me too.
go to Mom's Pupmobile.
Hi, my name's Jill. I'm here to draw your blood.
Okay. You have an arm that you prefer? Is it your left or
Would you
your
like
right?
me to stab your neck or your leg? Looks good.
He is. He's such a good dog.
Hi, you are so cute. This is Maximus. I'm gonna take him back with me, let Dr. Joya take a look, and then we'll bring you back up.
Alrighty. Maximus came to me 3 days ago, and he was found down by the river. So I'm taking care of him until I find him a forever home. He has hardly any fur. I noticed that he was a little itchy, and he's losing hair. I'm hoping Dr. Joya can make him feel better. He would probably like to be out of his little onesie, but he's more prone to getting sunburns. I haven't had Maximus long, but he's already made a very lasting impression. He is such a good little sweet disposition guy. He just wants to be held, loved on, and he gives you the best kisses, too. Here's your next one.
Oh, my goodness, you are really red.
Cute.
Oh, are you sweet? Look at those blue eyes.
Pit bulls get skin irritations all the time, but this dog is pink all over. I can only imagine how itchy and comfortable his skin is. It's like a human having poison ivy all over their body. I really want to figure this out.
Can I pick you up?
1, 2, 3.
Did you just 1, 2, 3 on your own?
I do. I tell myself so I don't hurt my back. It's a way to remember, and
It's a way to remember I am lifting this dog.
and it's also to let the patient know they're about to be lifted. They can count too.
We're gonna put this little muzzle on your face.
I don't want to have to restrain Maximus more than what's necessary, so putting this muzzle on will allow us to get this job done quickly.
He's so good. He's got some scratch marks on this side.
Yeah.
Oh, you're so warm.
He's hot like fire.
Warm.
It's very dry.
So good.
Okay. It looks like Maximus may have a condition we used to call red mange. What it really is a type of mite infestation in dogs. He might have mites.
Buddy, you do look like king of mites.
Demodex mites are extremely tiny. They cannot be seen with the naked eye. They are less than 1 millimeter, and they burrow down in the skin and live in the hair follicles. I'm doing a deep skin scrape. That's where you scrape until you get what's called capillary oozing. You want to create a little red raspberry on the skin. Deep skin scrapes are needed if you think it's a follicular mite, because mite lives down in the hair follicle, so you have to scrape pretty deep. We might need to biopsy him, but we'll start with these in-house samples first and see if we can at least rule out mites. If Maximus continues to scratch, he can end up with a bacterial infection, and his hair may never grow back. And for a foster dog with no hair, getting adopted gets a lot harder.
Good boy.
Dr. Tinsley is looking at a slide that he took for bacterial infection.
It's pretty boring.
Well, boring is sometimes good, so you're not seeing any infection?
No.
Okay.
Maybe just a little overgrowth? If that.
The good news is that Dr. Jeff does not see any signs of infection, but we know that Maximus is clearly suffering from something else. If there are no mites, then Maximus could have a bigger problem than what I thought.
Good boy.
Mites can be very challenging to find, but Maximus looks like a classic case of red mange, so I need to take a look for myself.
Your turn.
Okay, thanks.
For the money slides.
We'll see, we'll see.
Here we go. Big money, no whammies, no whammies.
Let's see. Oh, there it is. Super easy. So this is the easy button. Ding! This dog actually has mites. It has Demodex. That's the follicular mite I was looking for, and here it is on the screen. You can see one. Right here.
Oh my gosh.
Can you see it?
Yeah.
It's disgusting, right?
It's so gross when they're alive.
Dr. Joya lives for gross things, and she's super excited to dive into them. They give me the heebie-jeebies, but she's all about it.
So this one has 4 sets of legs. 1, 2, 3, 4 on both sides, so that's an adult. So this is good news because we can treat it. Usually a flea or tick product that you can get from your family vet will take care of these pesky mites and get rid of the problem.
So that's good news for you, Max. He's gonna look a lot better pretty quickly.
Demodex mites are not contagious, so if we can get the treatment to work and his hair to regrow, I'm confident that that will increase his chances of finding his forever home.
Hi, Jody. So it is mites, and it used to be called red mange, actually. So here he is. He's like a perfect example of it, a little red puppy. He should start to grow hair back in the next month, and the redness should start to subside.
It's really awesome. It makes me happy to know that it wasn't anything too scary.
He deserves a good home. He does.
All Maximus wants is to be touched and held and loved, and I'm gonna get him there.
If you want to bring him back in like 3 or 4 weeks, that'd be perfect.
All right,
We'll take a look at him again. Okay.
All right, you ready to go? Come on, sweet boy.
Thanks, Jody.
Thank you. I'm looking forward to seeing Maximus fill out his coat and actually look like a normal puppy. Come on, let's go. Let's go.
Jill, I have something in my pocket for you. Your laugh is making me nervous.
I really do like surprises, but with Dr. Joy, you never really know what to expect.
I don't like that laugh. Are you ready? Oh my sweet baby.
What is that?
It's my finger pointer.
I love that.
Hey, Jill.
I feel like
I'm your ears.
Come on, sweet Squirt. Oh, Squirt.
Squirt is the happiest little fellow.
I know you can't like my face.
Squirt is a 4.5-year-old King Charles Cavalier Spaniel. He has a history of hearing loss, and when he was in a few weeks ago, we discovered that he had a bulging eardrum on one side, and I'm suspicious that there may be a bulging eardrum on the other side. So he's in today for us to take a look and do a painless procedure called a video otoscopy or scope.
You're hard of hearing? We're gonna fix that for you.
Scope day, scope day, scope day. I love scopes. We puncture a tiny little hole in the eardrum, and then you get to pull fun things out of the ear.
This should make you relax a little bit.
I've pulled large amounts of hair or woolly worms out of the ears, tumors that seem to communicate with the eye. It happened once.
All right, Squirt, you're gonna get very sleepy.
Sometimes there's nothing, but you don't know until you look.
He's like, all of a sudden she has a cat finger. I bet that's really trippy after I gave him a sedation. He's like, wait a minute, I thought she was human.
This procedure is one of my favorites because I know how much relief it's gonna bring to little Squirt.
Everything's good right now?
It's working.
We are gonna start this scope.
The eardrum is very delicate, and it can be a bit of a challenge. So that's why I need all hands on deck.
But the left ear's the one that has the goo in it. Here it is, clear as day.
Wow.
It is a bulging eardrum. Shouldn't look like a mass in the canal. So
Put this down and poke it.
Yep.
It's an anticipation.
And right there. Oh, you poked it. We just poked a hole in the eardrum so we can let this mucin out. There it goes. See it coming out?
It's like a worm.
It looks like little worms kind of come out when you let that pressure out of the middle ear.
It looks like those things by the car dealerships where it's like,
Oh, I love those guys. It's a big old chunk of wax. Squirt, that would hurt.
Everything's going well with Squirt. He just has a ton of thick wax, so we have to spend a little time getting that out of the ear canal.
Try to get that material there. Okay. Ooh, I like your turning skills. Oh, yeah!
I was gonna say, don't pull it through.
When you watch it on the screen, it's like a big monster movie, you know? Like just squirrels out of there. It's just crazy. It's just so exciting.
All right, let's flush it.
I think this looks beautiful.
It does look really good.
We know that the left eardrum is bulging from the little peek-see that we performed at the first visit, but the right eardrum is a total mystery. If there's something more serious in Squirt's right ear, then his hearing may never recover.
All right, you guys ready?
Ready when you are.
Side B.
Now we have a dark cavernous hole.
Yep.
Look at that, seeing into the future.
Up, same thing.
Oh.
Pisum times 2.
2 bulging eardrums. Poor Squirt is suffering from PSOM in both ears. No wonder he can't hear.
Oh, yeah.
You just gotta suck it from that little hole.
There's the worm.
Get the worm. See if you can suck all of it out. Oh, let's see if we can pull it out. Nope, good. There it is.
Think I got it all?
I think so. Nice.
Squirt, you did good. We got the squirts out of your ear.
Now that I've flushed all of the mucin out of the ear canal, the eardrum has to heal.
You weren't to wake up. There you are. Toot toot.
You might experience a little bit of a head tilt after the procedure, but most of the time they do really well.
I know, it's okay.
From here, we just wait and see.
Here's my little crazy roll. Everything should be fine.
Squirt did really well with the procedure. I'm very excited.
I know. Yeah, we've had long talks today.
Hopefully he's going to regain his hearing. Thank you so much.
You're welcome. And we'll see you in a few weeks.
I don't get to go outside and play in the yard and have a good time tonight.
There she is. Lola, say hi to the camera.
How's Lola doing?
Lola is doing excellent.
Good.
Lola is a sweet senior pet that came in a few weeks ago for us to remove a giant mass on the top of her head.
Ready? There's some goo in the...
Are you kidding?
Now that the mass is gone, I need to check in with Mom and Lola and see how things are going.
Can you show me the spot? Has it healed pretty good where we took the tumor off? Yeah. Has she been rubbing at it or anything?
Nope.
So Lola's doing well. The biopsy site has healed very nicely. There's no signs of infection. And this is great because Lola's an older dog and we just want her to be as healthy and comfortable as she can be.
She been feeling okay otherwise?
Oh, yeah. She hasn't lost her appetite or anything, that's for sure.
Because it's been about 3 weeks. So you should be good to take the sutures out. If you don't feel comfortable snipping them out yourself, I would take her to your family vet and have them cut those out.
Okay.
Because the incision has healed well, there's no redness or discharge, Lola's in the clear to have the sutures removed. And before you know it, she'll be back to her old self.
So just call me if you notice anything there at all.
I will, and thank you for your help.
I'm so happy with the progress that Lola's experiencing, and Mom is happy. And as long as Lola's feeling good and she's happy, I can go home satisfied.
Thank you, honey.
Bye.
Bye.
Yeah, he's okay.
I love this cat. I just can't.
No, I'm not. This mask is safe. This says Lucky Dog. You might not want to be around me, but I think you're adorable. You're a good cop.
He's a cheap date.
He's a good boy. Hi.
Hi.
You want to go on in and have a seat? She will be in just a moment. I hear you, Bean Dip.
Yeah. Bean Dip is back, and it's perfect because it's Taco Tuesday. I'm going to take her sutures out and spill the beans on her biopsy results.
Hi, Bean Dip. How are you? Oh, let's get her out. Okay.
I removed 2 masses from Bean Dip, one on her head that appeared cystic, and one on her neck that seemed like a sweat gland tumor, but it was a little more irregular and a little more worrisome.
Hi.
This was the one that oozed a lot and kind of pain, but it did okay after?
Yep. She's an older cat. The lumps that she had were really ugly, and I just want to get that clean bill of health for her. Dr. Joya thinks that they're benign, but she wanted the lab to give her that diagnosis for sure. She was concerned about the lump that was in her neck, so that has me a little bit on edge.
So the good news is those were all sweat gland tumors. So they're benign tumors. They were adequately excised, so nothing to worry about. So all super good news.
Awesome.
Yeah, and you don't have to have the ugly mole on your head.
Are they things that would form again?
She could develop new ones, yes. Hopefully they won't regrow in this site. Could she develop more? Yeah.
Okay.
Yeah.
Bean Dip is cancer-free, and I'm very happy to tell her mom the good news.
There's no cancer, just annoying little sweat gland tumors.
Bye, Bean Dip. You missed Taco Week last week.
All right, take care.
Thank you.
Bye, have a good day.
To actually find out that everything's benign is just really, really exciting. Her future's brighter already.
But that's good news, Beanie. So excited.
Hi, good morning. You have Squirt with you?
I do.
We'll take him back and get him all looked at, see what's going on in those ears today.
Squirt and I are here today to see Dr. Joya to check on his condition and see how he's done post-surgery.
Good morning. How are you? How have things been over the last week and a half?
They've been all right.
Been pretty good. Have you felt like he hears any better yet?
Not really.
It's gonna take a while for his eardrum to come back.
A few weeks ago, we removed fluid from Squirt's bulging eardrums.
Oh, yeah. There's the worm.
When we do this procedure, you can create inflammation that, in some cases, leads to secondary infection. And today, we're gonna check and make sure that the ears are healing well.
You're in the room. He's a bouncing bean. Here I am. Yeah. Squirt.
I am a little worried that Dr. Joya is going to say that the procedure really didn't work as well as we thought it had. Then the Squirt's not going to regain his hearing.
All right, buddy. You ready? Okay, I'm gonna scoop you.
How have you been, Squirty Squirt?
Good boy.
I gotta look in there if you let me look in there.
The last time I tried this with Squirt while he was awake, he only let me look in one ear. But I'm hoping this time he trusts me enough that he'll let me look in both ears.
You ready? Can I look in there? He's not very good for this, so we'll see how he goes.
You're all right, Squirt.
Okay, you were very brave. Let me see the other side.
One down and one more to go.
Ready?
Here we go, little buddy. Squirt, squirt.
Squirty, squirt.
You're a good boy. Almost done. Almost done. That's a good boy.
They have not regrown yet, but that's typical this early on. Yes?
I see no signs of infection today for Squirt. But his eardrums have not healed yet, but that's okay. We just need a little more time for things to heal.
Sometimes people will like jingle keys and stuff, but he'd have to be asleep for you to really tell, if they can hear.
In the clinic setting, it's very challenging to tell if Squirt has regained his hearing. But I'm confident that once his eardrums have had time to heal, that he'll regain most, if not all, of his hearing.
So here I am, Mama. Hi. So tell Mama good news. There's no bacteria in the ears. The eardrums are still ruptured, which you'd expect, being this short out from his procedure. But typically between 4 and 6 weeks, the eardrum will regrow. So we should see that you're seeing some improvement, hopefully, with his hearing.
To know that there was actually something that we could do that would help his hearing loss, that just makes us very excited.
You're doing so good.
All right, well, bye, Squirt.
I love you. Glad you're starting to feel better.
All right, sweet baby.
Thank you.
Thanks, darling.
We love our pets. We would do anything for them, and if we can get his hearing back, we'd like to see him have the best quality of life that he can.
That's right.
I brought Maximus back today. He finished his treatment. When I got Maximus, he looked like a little pink pig, and he just looked really sad. But now he's definitely not feeling as itchy, and I'm really excited for Dr. Joya to see that.
Hi, how are you doing?
Good.
How are things going?
Look at you.
Maximus, this is our cute little puppy that was found down by the river.
Look how cute you are.
I have speckles.
Yeah, this is new because you have hair.
When Maximus first came in, we found that he had mites that live in hair follicle, and we treated him with a treatment that controls fleas and ticks.
Yeah.
You have hair and you have brown spots that you didn't have before. How cute.
and he looks amazing today.
How's he been feeling?
He's been really chill. Like, he's still slightly itchy. He just sometimes will itch at his back flanks.
Skin's still a little warm, but compared to where he was,
Maximus looks so handsome, but the only way to know that he's mite-free is to do another skin scrape and check under the scope.
look at all my hair, Jill. I wasn't expecting him to have this much hair this quickly. That's great. So we're doing a deep skin scrape. He's so cute. All right.
Good job.
I'm really hoping that I don't see any live mites today, and we can give Maximus a clean bill of health.
So I'm looking for mites, any life stage of mite, any skeletons, and I don't see any there. Clinically, you've got hair now. He's not beet red. He had lots of mites alive on his skin scrape last time. So far, I'm not finding any mites. Absolutely improved. We look so good today. Yay.
As a dermatologist, my goal is to get my patients as healthy as possible. It's not just a skin disease that we're curing. It's so much more. It's a chance at a new, happy life.
I just wanted to come back in and let you know everything looked great, and I didn't see any mites. So that's like super great news.
I feel so elated that he's feeling better. I'm already blown away by how much hair he's grown back. Like, that itself has been the most rewarding, just the best thing in the world.
Next time I see you, I won't even recognize you. You're gonna be a big boy.
To see Max looking so good, so fast, definitely makes my job worthwhile. He's turned around really quickly, and it makes me feel really good that I was able to help him.
All right, sweet boy. Call me if you need anything, okay?
Yes, for sure.
Right.
Thank you so
You're
much.
welcome.
I am very happy to say that Maximus is going to his forever home, a wonderful family that has a dog that loves him too, and he's gonna have a new name. It's gonna be Piggy Smalls, and I'm like super excited about it. They're just like gonna be the best family.
Come on, sweet boy. What is like your deepest, darkest fear?
I really hate spiders. I think I have a legitimate fear of wasps. It is what it is. I am gonna go talk to my client.
Oh, no.
The clownery.
Why would you do that to Charlotte?
Why are you like this?
Because I just like to play. There's a nice spot right there for it.
Oh, my God. I don't get paid enough for this.
Itsy spider, the water's about. Oh, is that itchy?
I'm Dr. Joya, and skin is my specialty.
Oh, your skin's peeling off.
When a mystery pops up, that case comes to me.
Let's start looking at you. Things are looking better.
This job can be sticky, gooey, and stinky.
Ew.
But I love every moment of it.
I love this. Amazing turnaround.
What are you being so wiggly for? Maggie is 14 years old. Say hi. She's been with me, well, for the last 3 years. Show me a dog and it needs a home, I'm gonna take the dog. Are you ready for bed? Maggie and I bonded very quickly. She's got a really, really cute personality, a little senior girl. Now, Maggie, hold still. I feel very blessed that I have her.
Is this Maggie?
This is Maggie.
Perfect. If you and Maggie would like to follow me this way, we'll get you settled in a room.
I came down here because she's got this lump on the right side of her body. It's big, and it's kind of purple, reddish, and it's shiny, and it's gotten a lot firmer.
And then I'm gonna have you and Maggie settle on in here, and Dr. Joya will be in just a moment.
Thank you so much.
You're welcome.
I can tell that it bothers her. It'll be okay. I've noticed that she doesn't seem to like to lay on that side. Maggie is very loving. She's not met anybody she doesn't love. But when people see that, they get grossed out. They don't want to touch her. They're like, ooh, it's just so nasty. I don't care. I'll sit and hold it. I'll say, I know. And heaven forbid that it's something that's going to spread. I really hope that Dr. Joy can get this taken care of because I have been worried about it.
Hi, good morning. How are you?
I'm good. How are
Oh, look at this sweet baby.
you? This is Maggie.
Hi, Miss Maggie. You are Mama's baby. I can tell that. I do tell that. Got this thing on her side, huh?
She's like a, I don't know, a 10-pound dog, and she's got a mass that's the size of a large lemon on the side of her body. And it seems like if it were my mass, it would cause me to fall over a little bit.
How long has that been there?
Started coming up about a year after I had her. I took her to have it seen, and they said it was a water-filled pocket, and actually just popped it. It came back with a vengeance.
Okay, well, that doesn't sound good.
No, and I mean, it almost came back where it's double.
If it's cystic and you just cut into it and drain it, a lot of times they refill because you have the lining of the cyst still there. I can imagine just with the gravity of this, it kind of pulls a little bit. It's heavy. I mean, it's got a lot of mass to it. That for sure is concerning, especially if it's changing in size. Because it's changing and getting bigger very quickly, it's always something that I think is a good idea to probably figure out what it is and get it off today.
Okay.
I think that it's important to take Maggie's mass off today for 2 reasons. 1, it's been drained before, it keeps filling back up. And 2, it's changing in size and growing, and it's grown much more rapidly over the last few months. That kind of characteristic concerns me that it could be cancer.
So you're going to take out the whole sac?
Yes, ma'am. It's gonna require a fairly large incision. So she'll be under full anesthesia, and then the biopsy is gonna let us know for sure what the tumor type is, and then if it's aggressive or not.
I love Maggie. I just want her to be okay.
Okay, Mama, I'm in good hands.
Thank you so much.
You're very welcome, darling.
Hate to see her go.
We gotta get this thing off of you because it's about a quarter of your size and weighing you down. I think it is a sweat gland tumor, but I'm worried because it keeps growing, yeah. The good thing is it seems like it's movable and not attached to her rib cage, so that's a bonus.
Maggie's mass is huge. When masses get large like this, they start to grow their own blood supply, and they can be difficult to remove because they bleed a lot. One of my colleagues, Dr. Gaines, who happens to be a skilled surgeon, is going to be on hand in case things got out of control with the bleeding.
Little girl, we're gonna get this off of you. It's like sort of translucent, like you can kind of see through it. Okay. Our favorite tumors are sweat gland tumors.
If I'm right about this being a sweat gland tumor, it's essentially a balloon-like tumor that secretes sweat into the interior of it. Usually those will peel out very easily, but if it's something more aggressive, it could be harder to remove. Oh, it's so perfectly round, and you can see through it. It's very translucent. Like if you were to put it up into the sun, you could see the light shine through. I think it's pretty neat.
It's like a jellyfish on your back.
Dr. Joya absolutely loves taking off masses and cutting into them, and I have all the respect in the world for her, but this is definitely her thing and not mine.
Oh, I'm about to give birth to a baby. It's coming out. Yes. Oh, you can see how translucent it is right there.
That is so wild.
Yeah, they're cool. All right. You see how it's like a water balloon? It's really pretty. Woo! Pop it goes. And now it looks like a deflated breast implant. Look at that. Sweat gland tumor, sweat gland tumor. Probably benign, I would guess, because it was so easy to get it out and well encapsulated, so good news.
After I cut into it, I see that it's just clear fluid. It looks like it's a typical sweat gland tumor. Dogs don't sweat like we do. They have sweat glands in higher density on their foot pads, and to create a sweat gland tumor is fairly uncommon, but there are sweat glands throughout the skin. So when things go wrong, then they multiply and grow and create tumors.
Here she is. Your Velcro dog has returned.
Baby girl.
She did very, very well.
Oh
She
my
did very
goodness.
well.
Oh my goodness.
Maggie's mass is not going to be anything that we have to worry about because I was able to get all of it, so it should not regrow. I am going to send it out for histopathology just to make sure that there's nothing underlying in the cells that made this cyst. We need to see Maggie back in 2 weeks to make sure the incision has healed well, but instantly she has a little bit of weight lifted off of her shoulders.
Oh, love her heart. It's awesome to see that growth off of Maggie. And now people won't look at her and go, ooh, you know, like they're afraid to touch her.
I will send it out when I get the results back from the biopsy. I'll give you a call.
I love Maggie, and she might be 14 years old, but you know what? Hopefully, she'll live another 10 years. You know, as a happy little dog. Say hi.
I have a lot of pent-up energy. Jill, can you show me the flipper dance? With the chair. Weird girl, but I love her because she makes me laugh. Sometimes I wonder what our clients think when they hear things like us dolphin calling in the background.
You walk with Mama? Come on, let's go. Let's go play. Come on. Ragazza, she's a happy dog. Come on, girl. She's so goofy and comical, and she loves people. Come on, silly girl. Goofy. She forgets that she's 115 pounds and thinks she should sit on your lap and give kisses. Come here, Goo. She's a character. It's just kind of sad to see her with all the bumps and problems on her skin. Quit that. Quit. Ragazza's got a bacterial infection in her skin that started when she was a puppy. Lay down, baby. Lay down. There we go. It stayed localized on her face until about a year ago. Good girl. And it spread through her whole body now. So now she gets large blood blisters on top of her feet, on the pads of her feet, in between her toes. Some of them are oozing, and then it gets pretty raw sometimes in between the toes. I know it's miserable. It itches a lot, which causes her eyes to swell, and then she can't see. She will do better when she takes a double dose of antibiotic and then gets sprayed down with antibiotic spray, but that's a miserable thing. She hates it. You know, I just hate to think of her in any kind of pain or discomfort. I think she's had enough. I'd love to see Ragazza just normal and happy and rolling in the mud and playing and having a blast, you know. Ragazza, come here. Hey, we're gonna see if we can get it straight, and we'll do whatever we have to do that will make her life better. Ragazza thinks this is a special Sunday.
Hi. Hello.
She loves to go anywhere that there's people.
All right, we're gonna come right down here.
Ready? Let's go, Ragazza. Hi, how are you? I'm Dr. Joya.
Hello.
How are you, Ragazza? I've been looking forward to seeing her with such a fancy name. So cute. Yeah, I know, sweetheart. She's very nice. Oh, man. It smells really bad.
Ragazza's here today, and she smells terrible. The smell is beyond dirty dog smell. It's kind of putrid, sort of a sour, really, really stinky smell. So I know that there's got to be infection present. I'm going to take a look.
This dog is such a mush. We just gotta get you back to beauty queen status.
I know you said her face is itchy. Does she seem itchy elsewhere on her body?
At night, I hear her a lot of times licking and scratching on her feet, and I don't know if it's because those knots get so big and tight and she's trying to bust them.
Ragazza's only 3 years old, and she's had deep, widespread infection for many years. It's sad to see a dog this young so severely affected. The toll that it could be taking on her immune system and the infection and how widespread it is a really bad thing for her.
I've treated many mastiffs over the years, and she's kind of at that delicate spot where she's got these fresh ones, and then she's got ones that are older, and then she's had such deep infection on her face that that's also caused scarring. It definitely looks like it's been going on for a long time for her.
I worry about Ragazza because it's been in her system so long, so I know it's affecting her overall health. I worry that if we can't find a cure, that it will shorten her life.
She is a good girl.
Lay down on your belly, or lay down.
Oh, man. Lots of inflammation.
Ragazza has deep infection everywhere. The lesions are open. She's got blisters as well as open sores in between her pads and in between her digits. And this is really going to be a big toll on her body and something that we really need to get under control.
I mean, you can see where she's scratching there nonstop.
Mm-hmm. She does have some scarring. I mean, these are like little furuncles, which just means deep infection.
Ragazza has really bad infection. She's been treated with numerous antibiotics by our family veterinarian, and they just haven't worked. So I'm worried that she may have a resistant infection, and we need to get to the bottom of it fast.
She is a good girl. Here's one I got a little pus out of.
Ragazza's got lots of pus, so there was no issue getting a sample.
Because you're okay with us doing blood work?
Yeah.
Okay. Here you go, Ragazza.
I'm also going to take a sample for blood to send out and make sure that there's nothing going internally that's causing her skin problems.
Look at this happy butt.
Yeah.
Ew.
Ew. Working around here, I have experienced a lot of smells, but Ragazza is next level. You want me to hold back the flaps?
You gotta stay here. Hey, focus on me. Don't focus on that. Good puppy.
Okay, we got it. There you go, buddy.
While I'm waiting for the culture results to determine if this is resistant, I've got to figure out something else to do.
She did very good for her blood draw.
In the past, all the other vets have tried oral antibiotics, and I'm going to do something different today. I'm going to try some topical therapy.
Where you go, baby?
When you do topical therapy, you're treating directly at the source of where the problem is, so it can work and be very effective. It's going to take a little bit longer to get rid of infection this way, but it may be the only option that we have if this infection is resistant.
You know, it's hard knowing that Ragazza's been poked and scraped and stuff so much that I know, I mean, she's friendly through it all, but I'm sure she gets tired of it. Thank you so
in a
much.
couple days, but call us if you're having trouble finding her meds.
Yeah. I'm hoping that when she gets the results back and all, she'll have the perfect plan and we can get it on the right track. Come on, Goo. Here we go. We gotta go up here. Come on, over here. Hang on, buddy.
He's skittish, huh?
Oh, he's adorable.
He's a good boy.
Scotty, he's a good guy. He doesn't cause any trouble. He's nice to be with.
Love you, boy.
Scotty's a pretty hefty guy. He likes the food. He avoids jackasses, you know, cats that are mean.
It's okay. It's okay. It's okay. He came to you as a stray.
Yeah, we actually thought he was feral. I've been doing cat rescue for 17 years now, and I feel super bad for cats that were obviously socialized as kittens and discarded.
Scotty's story, he and another cat were eaten out of a dumpster at an apartment complex. So we end up with fosters.
Scotty wasn't very friendly with us when we first met him, and when we got a closer look at him, it turns out his ears are completely full of growths, dozens and dozens in both ears. His ears are always full of goo, they smell bad, and because of the ear infections, he keeps having upper respiratory infections. With all these things growing in his ears, life's kind of miserable for Scotty. And it has to be uncomfortable, it has to hurt.
It's okay. He's very snotty. Okay.
My biggest concern is that this would be the end for Scotty and he hadn't had much fun yet. It would be awful.
What have you done so far for his ears?
We've mostly just been flushing them.
Yeah, it's okay.
It's being really good, though.
They're these kind of blue, they're called cystadenomas. They come from the seminal glands. So it's just going to be kind of a breeding ground for ick.
Cystadenomas are the result of clogged ceruminal glands, which are the wax-producing glands inside of our ear, and they start to create numerous little cysts. It can be big problems for many cats.
Poor baby.
Yeah, it's a little... See, because you can't even really stick a Q-tip in there because they're so closed.
I'm
sorry. Oh, no. There's some on your shirt.
That's all right.
He's flinging blood and pus, and the ear smells terrible.
Oh, no.
He's a good boy.
He's not good. I'll start looking at those slides. We'll be right back.
Hey, buddy.
He's probably got hundreds of little cystadenomas in his ear canals. They're occluding the opening of the ear canal, which also promotes infections.
So both ears have a ton of infection. And the right ear, which was the ear that was all bloody, he may have two problems in the right ear, so two different types of tumors. Even if they're both benign types of tumors, they're causing a lot of problems. I want to look in this right ear if possible, because that's the one that's a little bit worse. I know, you can't breathe, baby. There's a pink fleshy mass that's deep.
There's a lot of blood down in the ear canal, and it looks like there's a fleshy red mass down deeper in the ear canal.
We can try to investigate and see what's going on with deeper down in that right ear that's causing all that bleeding. Because I think there may be a tumor down in there, separate and different than these little cysts up top. We could get him on a topical and a steroid. I think a steroid would probably help to open up the ear a little bit, and that can be beneficial for when we did do a video otoscopy procedure.
Okay.
Oh, Scotty.
I'm starting a steroid to help reduce the inflammation in Scotty's ear so that I can perform a video scope in a few weeks. Once I know what I'm dealing with, I'm gonna try to remove as many of these masses as I can. But I've never had a case with this many cysts down in the ear, so I got my work cut out for me.
Thank you.
You're welcome. It was very nice meeting you.
Nice to meet you.
Bye, Scotty.
I think Scotty maybe feels worse than I even thought he did. I really hope that particular growth is something that could be removed and help him, because we definitely want to find him his own home.
I'm not dispensing anything, Jill.
Okay.
So I should have this done in a jiff.
Jiffy Jiff.
Have this done in a Jeff.
No one in my life ever said that to me. That's
No Jeffy Pop?
no one's ever said that to me either.
Jeffy Pop.
I'm
You
gonna
could
start
make it
calling you
like
Jeffy Pop.
Yeah,
Sounds delicious. I am a snack.
That's your new pet name.
Get it, girl. Bonnie Sue loves praise. Good girl. She loves people to love her. She loves people to pet her. She loves the limelight.
She's so beautiful.
She loves buttered biscuits. And so that's kind of how the name Bonnie Sue came about.
Guess what mommy made you?
I wanted to give her a true Southern Belle name. Southern Belles love biscuits.
You're so good, boo-boo.
In my mind, it all made sense.
Bonnie, what you doing?
Bonnie Sue has been through so much. Just seeing the love in her eyes makes it totally worth it. Bonnie Sue came to us a few years ago. She was found on the side of the road. The people who found her thought she was roadkill.
They were gonna just scoop her off the side of the road, and then she lifted her head up and looked at them, and so they knew that she was alive. She was in super rough condition. She had like open sores and was covered in scabs. She had virtually no hair. It was hard to really tell what type of dog she was. We dove right in, doing medicated baths, trying to feed her every 2 hours to kind of get the weight on her. I definitely think that she's made huge strides, but she's never fully grown her hair back. And she wants to roll around on the carpet and kind of rub her face into things.
Oh, so itchy.
She has nails that I've never seen on a dog. They are kind of curly and black, and they kind of go under, and so that can be painful for her.
All right, baby.
I do think that Bonnie kind of presents as somewhat of a medical mystery.
It's hard for us to see her in this much discomfort all the time.
We would love to be able to give her comfort from the itchiness that she has.
Here's mommy's baby.
It's really important for me to give that to Bonnie.
Dr. Joy will be in just a moment.
Is this Bonnie? I think
This
so.
is Bonnie Sue.
Bonnie, I get to see you in person.
I got a nice little packet for you.
Bonnie Sue's such a sad case, and she is here today as a new patient. I'm hoping I can do whatever I can to improve her quality of life.
Hey, girl. So I know she has a history of poor hair regrowth, and then she has chronic itching, and then she also has abnormal claws. Yeah, this looks like some kind of scarring from something. Yeah, she does have really funky claws.
She twitches real bad every time I accidentally touch her paw pads, so they seem really ouchy.
Yeah, okay.
We may never know what brought Bonnie Sue to the place where she was when her mom and dad found her, those terrible conditions, but if I don't get her skin and her itching under control and her claw disease under control, then she's gonna be miserable for the rest of her life.
Here we
Okay, Mama, see you.
I'm getting a blood sample today for Bonnie Sue to determine whether she has internal disease that's causing her skin and hair problems.
She just doesn't want to be restrained at all. She's barely restrained.
No, I don't even really have a hold of her.
Oh,
Bonnie Sue absolutely does not want to be restrained or sit still. She sounds like a little helpless gremlin.
Bonnie, really? She just snorted in my eyeball.
She's just cursing.
She's just so mad.
Bonnie Sue is making the most horrendous pterodactyl noises. I'm not sure what these are, if this is a Boston Terrier thing or just something from her, but we're gonna get through the sounds as long as it means that we can help her.
There she is. She had a lot to say, but she did fine. We had to get it from her leg, so that's where the Band-Aid is from.
Hey,
She had a lot to say. I protested.
We heard.
Little demon child.
It's so stressed.
She sounded like a cat howling.
Hey, you get old lady rights after a while. You can just do and say what you want. Look how good you are with your daddy.
After all that drama, Bonnie Sue is back in the arms of her daddy, and all is right with the world.
All of these black areas appear to be potentially scarring. When you got her, did she have crusts or open sores in these areas?
Yeah.
So,
Yeah. Oh, yeah. Sometimes if it goes below the level of the hair follicle, it will scar, and then they won't have hair wreath growth. Hard to know when you come from
I know, I ask her all the time,
strange
what happened to you?
beginnings. What did happen to you? She's like, you don't even want to know.
Seeing that picture of Bonnie Sue is heartbreaking. Looking at her today and how she's still suffering, there's so much going on with her. But I think I have an idea as to what's going on with her claw disease.
It could be that she has cutaneous vasculitis, and vasculitis can prevent the blood flow, and so sometimes claws can look like this as a result of that vascular disease.
Cutaneous vasculitis is just a fancy term to mean inflammation of the vessels. In this disease, the dogs will have inflammation that blocks blood vessels, and so the tissue that's fed by these vessels will actually die. Vessel disease could be causing the lesions on her skin, and it could also be causing the claw disease. Medication that I'd like to try to treat her claw disease will improve blood flow and help with wound healing and inflammation, and it has the added benefit that it may also help the hair to regrow.
We're gonna have to give it some time, a couple months, 4 to 6 weeks before you start to see initial improvement on the skin, but with the claws, it's gonna take longer.
While we wait to see if the medication works, I'm gonna send the blood out to see if there's anything going on internally that could be causing problems with her skin.
It's a rough day, isn't it? I know. It's hard.
she'll get some chicken nuggets and be all right.
Thank you so much for seeing her today.
You're welcome. You're welcome.
I understand that things like this take time. As long as she's not uncomfortable through the process, we're willing to do whatever we can for her because she deserves to live a comfortable life. Oh, yeah, she loves that.
Jill, is there a cat under your blanket waiting to see me? Yeah, I have a burrito for you.
Aww. I'll see real quick. Often the steroids will shrink the tumors, but they're still there.
So sweet.
He is. He's a little nervous.
Scotty's a rescue cat that has a tremendous number of cysts within his ear canal.
So it's just going to be kind of a breeding ground for ick.
It's very painful. It's creating a lot of secondary infection that stinks. But what's worse is he has something going on in his other ear canal.
There's a pink fleshy mass that's deep.
That could be something cancerous.
Oh, that's a good mama.
We're gonna do a videotoscopy procedure today and look down in his ears, see what's going on, and remove as many of these masses as possible.
This is your pedal.
Joya loves videotoscopy day.
There we go.
It takes a lot of communication. We never know what's gonna come out.
Do I look like a bug?
Yes.
And it's a real team effort.
Ready to go.
I'm doing the scope and I see lots of different bluish colored cysts down in his ear canal.
What we're seeing is a very narrow ear canal, and there's a lot of debris. This ear is just a cave system. Okay, let's see in this cavern.
Exploring Scotty's ear is like going into a dark cave. It's very narrow. There's all these crevices created by all these cysts, and it's a little challenging to look down in there and see what's going on.
These are cystadenomas. Polyps look very different. The ear might also have a polyp in it.
Cystadenomas are usually benign, so they're generally nothing to worry about. But if Scotty has a polyp, this could be a whole nother issue. Polyps actually grow from the tube that connects the back of the throat to the ear. And occasionally they will have tumors that are in the back of the throat that we'll need to look for.
Poor little Scotty.
There's a lot of blood down in the ear canal, and it looks like there's a red mass down deeper.
No, these aren't polyps. They're cystic, they are benign, but in his case, they're occluding the ear canal and creating a lot of inflammation.
There are no polyps in Scotty's ear, which is great news. The fleshy pink mass was just another cyst. Now that I've gotten a good look with the scope, I'm gonna pull out a little laser and take care of all these masses.
This is the laser with the green tip, and so you touch it to the tissue to zap these little masses. Lasers are nice because they cut and coagulate. Ooh, that was nice. I like that. Get it, get it, get it. Piece of it. Mm-hmm. Nice.
They look like ticks.
Yeah, they do. Get their little hairs on it,
Sure
so
does.
sort of gross. But Scotty will now have a more open ear canal.
A nest of ticks.
There it is. Yeah, it's a lot. Nice. That looks good. Look what we did. So we're gonna start coming out and just work our way out.
There are so many masses, that I know that I can't remove all of those.
Cut your little cysty thing off now.
Using this laser, you're essentially burning some of these cysts to remove them that way, and they can actually scar the cartilage. So you have to be very careful with the number that you remove, and I think this is gonna give him a lot of relief.
Here comes the fun part.
Joya loves this laser.
I'm gonna get this big kidney bean shaped mass out of here.
Now that she's able to zap things, I mean, you need to stay out of her way. She's just gonna be zapper happy.
Scotty, you're gonna feel so much better in a few days. I want it. I love this.
I thought you would.
Oh, there it is. Another little brain. It's very firm, but also cystic.
Oh. Looks good, Joya.
Yeah. That's all she wrote. Yeah, let's cut into the big mass.
Cystadenomas come from the wax-producing glands in the ear.
Just looks like kidney in there.
They're blue in color because it's a mixture of sweat, wax, and dried blood.
Gross.
Scotty's ear should heal over the next couple weeks, and I'm hoping when he comes back in that his ear canal is more open and that it looks more like a normal ear.
Hey.
I hope that that's enough, that'll give him enough relief. I'm hopeful for that.
Hey, buddy.
I mean, we were really concerned that there was going to be something super bad under the benign tumors. So this is great. Scotty will be staying with us as long as he needs to be. And maybe he'll not only feel better, maybe he'll get his own home. Let's go, Scotty boy. Come on.
Gaza. Come on, baby girl. Gaza's back to see Dr. Joya for her skin. Come on. It's been, what, 2 months maybe, I guess, since we started it. Come on, Goose. She's got a bacterial infection in her skin that we've been able to treat some and hoping to clear it up today with the vet. Hi, Boo. You're looking good. She's wound up today.
Hi, how are you?
Mergaza's back today. A couple months ago, she came in with severe skin disease that she'd been suffering from for her entire life. When I started topical therapy to treat all of her skin lesions, I did get the culture results back, and her infection was resistant, and I started her on an oral antibiotic to help with that infection. The hopes are that her skin is improved and that she's feeling much better and more comfortable.
How's she doing?
She's doing a lot better. Her feet and everything look good.
Great.
Doesn't seem to be oozing anywhere and not scratching constantly.
Her feet are a lot less swollen.
Yeah.
So.
They don't seem to be irritating or something.
Look how pale they are. They're not even bright red anymore. That's so good.
She's definitely doing much better. Spunkier. I can tell she feels better.
Good.
Ragazza so far looks really good. Honestly, if you could smell the room that she's in today, it smells pretty reasonable. And last time, she smelled really bad.
She looks so much better. I'm so happy.
Or with, you know, because she said,
she's happy today.
Yeah, she's feeling much better.
I was gonna say, I don't remember her chatting as much before.
No, that's what I said. She's definitely feeling better.
Feeling better. Oh, Ragazza.
Leave that toe
All right,
alone.
well, look at these slides real quick, okay?
Ragazza's infection is very resistant, and resistant infections can be very challenging to treat.
We'll just be a few minutes, all right?
All right.
I'm gonna do a skin sample and look at it under the microscope to see if her infection has resolved. If we can get rid of this infection, she's gonna feel so much better and just overall have a better quality of life.
Come here, go.
She's got a little bit of bacteria, but pretty mild, and looks so far better than before. It's not gone, but she's feeling and looking a lot better, and I think if she could get some more topical therapy going, that would help a lot. All right, so I think I have some reasonable news. I can't say that the infection is completely gone because I'm still seeing bacteria that's there, but it looks mostly like overgrowth. That just means that it's stuck in the nice, moist, humid environment of a mastiff foot.
Yeah.
So cleaning her feet in between the toes, she needs like a daily pedicure for sure, where you just give her like a little foot bath.
Right.
With Ragazza responding well to her topical therapy, I'm gonna increase it to see if we can get this resistant infection taken care of once and for all.
I want to do 1 more month on the antibiotics. Okay. Next month, we'll try to taper to every other day.
Okay.
She's going to always be, unfortunately, a girl that needs a little bit of extra. But she's an extra dog, so that's okay.
Cases like Ragazza are tough. They take a lot of time and commitment, but this is why I do what I do. I love to do it and help moms and dads get their babies back to where they should be.
Sweet girl. Come on, ready to go? You don't want to get your hopes up because she's been through so much. We're talking about something that's been going on for about 3 years. And I mean, to see her in 2 months, how much she's improved is just awesome. Ready? Out, out. Come on, out. Walk. Come on. Well, she looks like she'll be back to the spoiled queen bee that she thinks she is, you know. Come on. But no, it's fun to see her being back to the fun, playful dog that she was before. Come on, watch the step. I'll be forever thankful that they've kind of given her back, I guess. Goofy. Gaza, come here.
Goodness, she's shaking. She's nervous. I'm bringing in Maggie today for a recheck. I think Maggie looks really good and curious to see what Dr. Joya thinks.
I'm gonna take her inside. Dr. Joya is gonna take a look at her, and then we're gonna bring her back out.
Maggie was in a few weeks ago for a mass removal from her ribcage area.
Like a jellyfish on your back. Oh, you can see how translucent it is right there.
The mass was benign. It was a sweat gland tumor, so nothing to worry about there.
And now it looks like a deflated breast implant.
But I am concerned about the incision since it was a longer incision. Just need to make sure that it healed well.
I want to see what size onesie this is.
Maggie! What size onesie you
I'm
want to borrow it
guessing-
for your daughter?
Maybe 3 to 6.
Maggie wasn't doing good in the beginning because she was chewing at the stitches. No. I tried everything, 3 different types of cones. She could get to it. Nothing seemed to work. And somebody said to me, why don't you put a onesie on her? Got 2 onesies, put them on Maggie, and she's been perfect since.
Maggie.
6 months.
Oh, 6 months. You move better not having that friend on your side.
Oh, Maggie.
The onesie idea is brilliant because it's actually a protective piece of clothing. It's not just for fashion, it's to keep her from scratching and trying to go after the incision.
She did pull out a few of the sutures at the bottom, but that has now healed nicely.
Since Maggie did rip out her sutures, we're gonna keep her on an antibiotic for a few weeks longer to make sure everything heals well.
1, 2, 3.
But she should be feeling better now that she doesn't have Cousin Ed on her side.
Here I am, Mama. She really wants pants back to you so badly. Here she is.
How did it look?
It looks wonderful. Looks wonderful. Literally, a weight is lifted off of your shoulders.
Dr. Joya, I really appreciate
You're
everything
welcome.
you've done.
Now she can live more comfortably for sure.
Absolutely.
Yeah.
Now, completely different life for Maggie. Maggie can lay on that side now. People didn't want to touch her. The grandkids didn't even want to touch her. They can now hold her, touch her. Damn, all better.
Is she in the waiting room?
She is. Okay, I'll be there in a minute. Bonnie Sue is back today for a recheck. She was originally found and thought to be roadkill, and so she is here today for a sale she's doing. She has improved, but she's still struggling.
She does have really funky claws.
Her paw pads seem really ouchy.
Even though Bonnie Sue did protest, I did submit blood work to see if there was anything going on internally that was causing her skin and her claw problems. While we are waiting for the test results, I prescribed a medication that I'm hoping is improving Bonnie's claw disease and also improving her skin and hopefully regrowing some hair for her. It's been several weeks since I've seen Bonnie Sue, and she's back today, and I'm really excited to see her.
Hi, how are you guys doing? Good, how are you? Bonnie Sue, how are you?
Oh, my goodness.
You're so pretty.
Bonnie Sue's dress is the cutest thing.
Look at you. Got a Love Shack fancy dress on.
Mm-hmm. She is absolutely adorable in this dress.
You look so good.
Without all of her hair, Bonnie Sue needs a little bit of extra help staying protected from the sun and staying warm, so she might as well look cute while doing it.
Hi, baby. We don't have to do any blood today, see?
Yay.
Yay.
Bonnie Sue looks amazing. I can already tell that there's much less inflammation. Her skin's not as bright red. She's not as irritated looking. She has some hair regrowing.
Some of this, you know, of course, could be scarring, but we'll give it a chance. I mean, it looks like there's a little bit of peach fuzzy coming back.
Right. The medication that I started Bonnie Sue on was already showing some improvements. She has less redness on her skin, her claws seem more comfortable, and there is a tiny bit of hair regrowth already.
This blood work looks great. We got the chemistry panel and we did a thyroid panel. Her thyroid panel looked great, so no hypothyroidism. Nothing to worry about there.
It's very satisfying for me as a dermatologist to help Bonnie Sue feel better, to improve her skin and make her feel more comfortable. It's going to take a while for her hair to fully regrow and for her claw disease to improve, but we're headed in the right direction.
Well, I'm so glad she's doing well. I can tell a big difference.
Thank you so much.
You're welcome. I'm so glad you guys brought her up here. We were able to help.
Hi.
We have spent years rehabilitating her with medication and special diets. And now, today, we're overjoyed that she'll be comfortable, not just surviving, but she'll be thriving. Come on, kiddo.
Wow. We're back with Scotty. We're back for post-surgical. He seems happier. Cats are so resilient.
How are you, Scotty? Let's see this friend in here.
Hey, buddy boy.
The last time that Scotty was here, I removed a bunch of cysts that were growing in his ears.
Scotty, you're gonna feel so much better. Oh, there it is. Yeah, that bigger one is still got some healing to do. But it's so much more open. I couldn't get a Q-tip down in his ears. I was worried that he had a polyp in there, but we didn't see. Down deeper, it looks like it's healing. It does look more open. His ears smell so much better, too. Oh, he's the best baby.
This case was a tough case because there were just so many masses that needed to be removed. I need to check the slides from Scotty, but so far it looks like we're headed in the right direction.
We still have little ways to go. There is still infection, but it's less than what I saw before. But he's feeling much, much better.
With some new medications to treat his infection, I think that we're going to get this under control once and for all and help him to find his forever home.
All right. Well, these are the meds.
So much.
Call me if you have any trouble with anything. Bye, baby.
All right. This has really been worth it. It's worked out really well. You get kind of like a feeling that there's no hope for this cat, you know, that he's always going to be sick. You're not going to find a home for him. And now it's a lot easier life for him, and we're really happy about that. He seems happier. It's a lot of fun. It's like seeing him be more like a kitten.
Whoa! Off to the races. Bonnie Sue's been home for a couple of months now, but we definitely are seeing improvement. Go this way.
Bonnie, you always knew that she was uncomfortable because she would chew at her paws, kind of be grumpy. But now she doesn't do any of those things. She just looks so good. Her hair is growing back. Her nails are starting to look normal for her. Her skin feels soft. That really is the biggest thing for me, is to be able to hold her and pet her and it feel like I'm petting a dog that has hair. It seems silly, but it's amazing. She will always look different than most dogs, but those are things that make Bonnie who she is. So we love that. Looking good, gal. Her story, it's both heartbreaking and amazing. You get that defeated animal that has been through so much, and to see the way that she's been able to bounce back and how you can change an animal's life for the better.
Yeah.
It's been super rewarding for us. Yeah.